Welcome to Education, Health, and Environmental Affairs. Some of our committee members may not seem to be working because their seats are empty, but they are in the complex working or testifying or in meetings, and that's for those who are streaming or here in person. Before we start on today's bills, we have, I think, 13. There must have been some misunderstanding on some of the bills. On non-cross-filed bills, the situation was to allow up to 3 proponents and up to 3 opponents besides the sponsor of the bill. We have a couple of bills where there are 6 or 7 people, so we're going to ask people to either stand down or decide among yourselves who can provide that testimony. So I don't know why this happened or how it happened, but on those 2 or 3 bills where there are lots of people, either favorable or unfavorable, we're going to have to decide who can best convey the information. That being said, we're going to start with Delegate Solomon, HB 19, followed by HB 966, then followed by Delegate Washington, followed by Delegate Guyton. Delegate Solomon, school construction, pedestrian safety plans. If Joseph Jakuda, Joshua Feldmark, and Christy Daphnis want to join him, welcome.
Thank you, Mr. Chair. And unfortunately, Joseph could not join us today. He sends his regrets. But thank you for the opportunity to present. It's nice, and this is the first time I've been back in person in front of EHE in a while, so it's good to see you all. So this is a bill, this is the 3rd year. It kind of ran into a little bit of the COVID buzzsaw with timing, so really excited to bring this back and appreciate your consideration. So I'm going to start off, I don't think any of us need to be reminded of what we've seen lately with sort of aggressive driving and some of the really terrible statistics around, pedestrian deaths and pedestrian accidents that have only really increased since the pandemic, and people, I think, thinking the roads are not clogged anymore. So in the testimony, there's some really harrowing statistics in here, particularly around incidents with kids. Usually, particularly again, they spike in the fall around daylight savings time, and it's really, really unfortunate, and it's across the state. And so the genesis of this bill was to try to figure out what's sort of a small way that we could, at the front end, when you either rebuild a school or you build a new school, or you make a substantial renovation, how do we involve the community in talking through pedestrian safety for kids? And that's really what the heart of this bill does. It requires, when a school system, again, puts in for new construction or a renovation where they're going to add at least 100 seats or more to the building, that they have to have a pedestrian safety plan. And that pedestrian safety plan has to include the community. I think there was a little bit of confusion among some of the school systems, and we've had plenty of conversations around it. This does not require them to go out and build a sidewalk on a state road. We understand that's not in the purview of our school systems. But what this does do is it requires the school system to start the conversation with the local Department of Transportation and the State Highway Administration to have that conversation about what are the things that we could do. Often before we make an investment, sometimes as much as $100 or $150 million in school infrastructure, if you have that conversation earlier, well, maybe there is a little trail that we could add or an extra sidewalk abutting the building. It's a lot easier to do that on the front end. Or it may be something as simple as, we've got to put a hawk signal in, or we've got to upgrade and update the timing on signals, or we've got to repaint crosswalks. Things that, in the grand scheme of things, are pennies on the dollar, and things that most of the time, if the conversation can get started early enough, they're really easy to fix. And so that's, again, sort of the crux of this bill. We made one, I think, pretty significant change in the House this year. We went through and made sure that the IAC does not essentially get to refuse a plan. They don't get approval. They review it, but it is up to the locals to build the plan, to determine what's in the plan. The IAC cannot prevent anything from going forward as long as a plan has been submitted. And we wanted to clarify that because we know there's been a couple of instances, unfortunately, where I think we feel like the IAC has overstepped its bounds, and that, again, is not the intention of this bill. The other change, we actually made this last year. So the bill originally applied to everybody. And we understand that obviously some counties have a very different, very different density. Even within rural counties, the density changes. So I worked very closely with now Senator Quarterman, who was a member of the Appropriations Committee before coming over here, to make an amendment to the bill where we changed it to include essentially to focus primarily on high-density counties, and that's listed in the bill. And for low-density rural counties, we made an exception that for cities within those low-density counties. So again, with Senator Quarterman, the example was Hagerstown. So most of Washington County, you're probably not going to be able to walk to school. It's just, the density is not quite there. But in a place like Hagerstown, that density is there. And so he wanted to make sure, and so did the members of appropriations who represent more rural jurisdictions, that we had that covered. And so what we say is, in a low-density county, in a city that has 10,000 or more people, this would apply to school construction in those areas. So we really felt like we struck a really good compromise. This bill had really wide bipartisan support, both in the Appropriations Committee, in the House of Delegates. And so just really hopeful. I know time is short, but really appreciate you all taking a look at this bill and considering hopefully a favorable report. And we'll turn it over to the advocates who are with me today.
Please.
Okay, I think I'm up first. My name is Christy Daphnis. I chair the Montgomery County Pedestrian, Bicycle, and Traffic Safety Advisory Committee, and also am engaged in several statewide pedestrian and bicycle advocacy efforts. HB 19 is critical to providing students across the state of Maryland with options for safe pedestrian and bike routes to school. Currently, there's no requirement to plan for pedestrian infrastructure as a condition of state funding. This is really important. This requirement would move up important conversations which are crucial, as it often takes several years for the state to install a simple signal or crosswalk. I myself advocated for 6 years for a signal to be installed along a state highway less than a half a mile from the middle school where my daughter now attends. To improve safety for our school-aged children, statewide funding approval processes should include measures that require school systems and other agencies to collaborate with communities to fully assess the volume and impact on pedestrian and bicycle trips and the associated infrastructure needs around new and significantly renovated schools. All students within walking boundaries of schools should be able to safely walk to school, especially if the school is new or major renovations take place. A new school without a safe walking and biking route for students is a missed opportunity, especially if the lack of safe route is due to poor planning and mismanagement. HB 19 would provide a reasonable mitigation of the problem. I'm testifying in support of HB 19 because it would improve safety and pedestrian access for students. It would ensure community engagement on factors beyond the strict four walls definition of the school facility itself. It would vastly improve cross-jurisdictional coordination, and it would encourage improved stewardship of taxpayer dollars by requiring thoughtful assessment of nearby infrastructure. And this is not just a problem in Montgomery County, it's important across the state. We need to provide safe routes to school for all school children, and a good place to start would be here on new schools and schools that are facing major renovations. Thank you very much.
Thank you. Mr. Feldmark.
Yes, thank you. My name is Joshua Feldmark. I'm here representing Bike Maryland, and as you'll see in my written testimony, I go out of my way to mention that Bike Maryland, we have over 18,000 members from across the state, and we represent a broad swatch of folks who ride their bicycles. So that includes people who use it for transportation, that includes families who use it for recreation, and the what we like to call the road warriors, which I clearly am, as you can tell by my physique. And I bring this up because, not my physique, but the breadth of who we represent, which also is more and more including pedestrians, because we do have, and it's been a long time since we've been in front of this committee, but we do have a bit of a reputation in other committees as representing more so those road warriors, and we fight for bills like the 3-foot pass, the elimination of the narrow road exception, vulnerable road users, and there is a fair amount of healthy discussion and debate around those issues. And offline, I would be more than happy to, if you are on the other side, I'd be more than happy to explain why you're wrong. But in this particular case, this is something that I really think we can all agree on. I'm very optimistic that we can all agree on. And that's the very simple point that if you're a child who walks to school, you should be able to do it safely, full stop. And then it's the recognition that that safety does not come through luck. It comes through planning. Additionally, that safety cannot rely on all drivers obeying the rules all the time. If we rely on that, we will be disappointed and they will not have the safety. Rather, it relies on the infrastructure to make those children safe. And so with that, I urge a favorable report.
Thank you. Questions for the panel? Questions for the panel? I do have, excuse me, one, Delegate Solomon. I know a number of school systems set distance requirements when exceeded, that requires bus transportation. How does that fit into this bill? In other words, I know a mile, mile and a half. I mean, I don't know if that's done by county and how much it is varied among the 5 or 10 very urban counties. How does that fit into the bill?
Yeah, so I will admit, I'm not 100% certain. I think it might be a county requirement. So that really wouldn't factor into any of this. I mean, if anything, I would say it might actually, I think if there were better planning on the front end of building schools, you might actually see fewer kids taking a bus. So for example, even just in my neighborhood, the MCPS rebuilt a school actually a year or two before we moved in, and you have to cross a state road. And we've been working really constructively with both our local transportation department and the state highway administration to upgrade it. It's on 410 East West Highway, and the school system has to pay for a bus to bus kids in our neighborhood to cross East West Highway because the state highway administration didn't put the infrastructure in place for safe crossing. They actually have pulled a crossing guard out. So that's an example where I think with a small fix, primarily it would have been on the state highway administration to make those fixes. But I think if that collaboration had happened earlier, the school system probably would be saving a significant sum of money on transportation by not having to bus all those kids. They could have a crossing guard. Those students wouldn't have to take a bus for literally half a mile. Better for the environment, saves the school system money, and not on them to do the infrastructure improvements.
Right, and regarding new construction opposed to adding 100 seats or
Right.
renovations, you know, some counties are limited in property they own and where they place them.
Correct.
It's not like free to be you and me, and they can put them anywhere. There are some implicit limitations on where they do it in terms of near a large highway or very isolated. But again, in most cases, the mile, mile and a half, whatever their requirement is, has to be upheld, I would assume.
Right. So they could still, they would still have to, whatever their requirement is, they would still have to provide theoretically the transportation for students that wanted to take advantage of it. And again, I think it's important to note, I think we all would have, some of us would have loved to have a bill that said, it is now the responsibility of the county or the school system to do that, to actually make the improvements. The bill doesn't do that. The whole point here is to say, we think by having a collaborative process earlier on and engaging the community, most of the infrastructure improvements are probably going to be small fixes that, just common sense would say, oh yeah, we should do this. There is nothing in here that would require a school system to build a new sidewalk or to shrink the footprint of a road to make things safer.
Senator Riley.
Very much, Mr. Chair. Delegate, good bill. Was there any opposition in the committee?
In the Appropriations Committee, there were 2 no votes, and that was it.
Was there any written or oral opposition to the bill?
There were, from, again, some of the school systems wrote in, and actually the Anne Arundel County Public Schools did write in. I think, again, there's a misconception, and, that's why I wanted to make it clear from the outset. There's nothing that requires the school systems to make an improvement. So if they determine in their conversation with the State Highway Administration that maybe on a state road, it would be really important to add a sidewalk, the school system's not on the hook for that. We would hope that the State Highway Administration, and in starting that conversation with the community, might make it into a county priority letter, or there may be advocacy with the State Highway Administration to do that, but there is nothing in here that would force the school system to do it, and I think that was the misconception. A couple of school systems said, oh, this is going to cost us hundreds of millions of dollars. Again, there is nothing in here other than the requirement to meet with the community and put a plan together, but they are not on the hook. If everything in that plan says this needs to be a state highway function, we hope State Highway Administration would see that as important, but it does not require the school systems to then have to spend the money on it.
Thank you, Mr. Chair.
Thank you, Mr. Chair. Delegate Solomon, thanks for the bill, and I totally support the concept. I'm reading MABE's opposition testimony, the Maryland Association of Boards of Education, and they're worried about both the mandate as well as the sort of broad brush high density, low density. So I totally got what you said about Senator Quarterman, then Delegate Quarterman, pulling out Hagerstown from a low density area, and that makes great sense. What I noticed, though, is of the high density counties, we don't allow for rural areas, because in all of these counties, there are very rural areas in Montgomery and Prince George's and Anne Arundel and stuff, and we don't exempt those. Is that something you've thought about at all and had conversations with MABE or others?
So MABE did not bring that up directly with us as we worked on this in the committee. And, you know, we made the changes to the density a year or two ago. So that part of this bill, when we pre-filed it, did not change. And that was something, you know, I think our committee felt comfortable saying, for the most part, the schools in these counties all sort of fall into the high or low density areas. I mean, I think if, you know, in additional conversations, there needs to be tweaks to that, I think we'd be more than open to it. But the change for the rural jurisdictions was important for our members on appropriations and seemed to satisfy the concerns that we had.
Thank you, Delegate. Thank you, Mr. Chair.
Thank you all. I'm sorry, Senator Ellis.
Yeah, thank you, Mr. Chairman. Delegate Solomon, great bill. And I apologize, I came in a little late. So I'm just reading through this and listening to you. So this bill just called for a plan of action. Is that?
Correct, correct. Yeah, we, the hope is, again, you know, and actually our school system even said to us, you know, they had a school where, you know, they have been supportive of this bill, and so they've been trying to implement some of the principles already. And so they said, you know, they had a school, actually, I think in Clarksburg, where they had this conversation, and they discovered that there was a small bike path that was part of the county's park system. And the whole engagement around pedestrian safety caused them to go to the Parks Department, and Parks said, oh yeah, for like $25,000 or $30,000, we can update this path. And I had a parent say to me, it's the first time her child was ever able to walk to school. And it was just through the process of having this conversation and thinking through how to get kids to school other than through a car or a bus,
Yeah.
that improved that system.
Yeah, thank you, because a couple years ago, I put in a sidewalk bill, I called it, and they was like, it's too expensive, like, you said, hundreds of millions, and, okay, so nothing gets done. So, and because I know there's one school in Waldorf where students, high school students walk to school, but there are no sidewalks. So one day I saw it snowed, and they were actually on the road, you know, the snow bank up on the side. It was so dangerous.
Yeah.
So look forward to, you know, look at this and see what solutions we can get from it. So
Thank you, Senator. Thank you.
Thank you all for your testimony. There is opposition, but it's written only, so if you'd like to look at that as it was referred to, you can go online and look at that testimony. Okay, that completes the hearing on HB 19. Let's go to 966, academic credit for prior learning examinations. If Mirta Valdesbradner wants to join the good delegate, that'd be great. And there is no opposition, either oral or written. Delegate.
Thank you. Thank you again, Mr. Chair. Again, for the record, Delegate Solomon. Yes, this bill was, not that there was a ton of opposition on the other one, but this had no opposition, passed unanimously, both through appropriations and the full House. This is the result of 2 years of work. We started the process on this bill 2 years ago in budget study language and have worked with MHEC. And so this year we came back with the bill after MHEC worked with higher ed. Basically what this bill would require is a standard across our public universities, so the USM and our community colleges, for prior learning. Things like advanced placement, international baccalaureate, the Cambridge Analytics exam. And it would require that there is a standard for AP of the 3. A 3 would get you credit. It leaves room for individual universities to say, well, we may not give you major credit, but we're at least going to give you course credit. And leave some, again, jurisdictional wiggle room for each individual campus, but it would say that we can confidently say to our high school students, as we promote AP and IB through the blueprint, that if you hold up your end of the bargain, you're going to get college credit. Because if you look at it now, it is kind of a cross. It makes you go cross-eyed when you look at why some schools give a 3 or some schools require a 4. You know, literally schools where a professor may teach at both both institutions. One of them requires a 4. One of them would say a 3 is good. If you look in the testimony, there's a ton of really great statistics in here about what happens if you are a first-generation student who gets college credit for their AP. You're much more likely to succeed. The one that I do want to highlight is, so Maryland ranked 6th in the nation in AP performance, and if we had had this bill in effect a few years ago, students and the state would have saved potentially $63 million. Because if you get credit for it, that is a course you then don't have to take again. So the last thing I will say before I turn it over is we worked closely with the university system. We made one minor tweak in the House, was just to clarify some of the data language, but they are fully supportive of it. They've been a great partner to work with, as has our community colleges. So would ask for a favorable report, and happy to take questions as well.
Good afternoon. Thanks for having me. My name is Mirta Valdesbradner, and I'm testifying on behalf of my fellow AP advocates who could not be here but submitted their written statements as well. I'm an AP Spanish language and culture teacher at North Carolina High School in Caroline County, and I have taught there for 19 of my last 26 years. Caroline County, as you know, is a rural agricultural community in the heart of Maryland's Eastern Shore. As an educator, I want to express my support for this bill, for the Bill 966. AP, college, CLEP, and IB combined rigorous college-level work study with nationally recognized assessments. These programs create opportunities for all students, regardless of race, ethnicity, age, socioeconomic background, to potentially earn college credit for their hard work in the classrooms in our states every day and in our schools. As an AP teacher, I have been scoring the exam, and I can tell you that the scale is from 1 to 5, and research is determining that scores of 3 or higher are appropriate for earning college credit. Yet, some of our public colleges and universities do not give credit for earning that, and that could be a detrimental impact on our students. For example, in my own course, the majority of the students who earned a 3 in the AP exam last year were minority and low income. Whether or not the lack of uniform credit policy harms our most vulnerable, students make the transition to post-secondary education even more challenging. Protecting credit awarded in transfer is also a unique issue for Maryland students. Students who started a community college may lose their AP credit when transferring to a 4-year university if that school requires an AP higher score. You can imagine how upsetting that would be for a student who thought they were going to start their major close to study, and they have to go back and take some of the introductory courses they already had approved with a 3. One of the parents of one of my former AP students, the last year earned a 3 during the pandemic, in a course that was taught last year virtually, which was very challenging for students and for teachers, wanted to send this message, quote, "As a parent of a future college student, it will be greatly impact our ability to send my child to college, as college costs are a big rising factor in our family's current finances. Having the option to take additional coursework in high school to meet the requirements of an AP class and taking the AP test that could
Okay.
then grant her college credit."
That'll be great.
Okay, sorry.
Thank you.
Okay.
We have a lot of bills today and a lot of voting. Questions for either two panelists? Questions? So USM is not testifying for or against? I'm looking at the sheet.
I was going to say, I think they submitted written testimony. If not, I can make sure that the committee gets it. But we did work hand in glove with them. Again, the small change that we made we clarified the language in the data request at the end of the bill to make sure it was what they wanted.
So even though some of their professors were not abiding by this, they're now committing to do that prospectively?
Correct. Yeah, and I will say there are 31 states that have already done this, and this is the recommendation of the American Council of Education.
Okay.
For
Questions? Seeing none, that completes the hearing on 966.
Thank you.
Thank you.
Let's go to HB 23, School Discipline Data Collection.
Thank you, Mr. Chairman, members of the committee. For the record, Delegate Alonzo Washington here to present on
Delegate,
House.
do you want to bring up Frank Pathella?
Sure.
Is he here? Seeing not,
I'll take his 2 minutes.
okay.
Thank you, Mr. Chairman, members of the committee. Delegate Alonzo Washington here to present on House Bill 23. This bill represents a recommendation from the Maryland Commission on School to Prison Pipeline and Restorative Justice for Justice Practices that will expand the accessibility of school discipline data and lower the threshold used to identify schools that disproportionately suspend subgroups of students. This bill came in with language, as you can see, we changed the title, but came in as a bill that had something to deal with school resource officers. We took took that out completely this year. The reason we want the discipline data committee is because, and disaggregated, is because you'll be able to see any disparities within the data of suspensions, and school systems will be able to learn from those themes and things that are happening within the school system so they can adjust their behavior as well as the students' behavior and how they treat students within the classroom, in hopes that we can keep our kids in the classroom and implement more restorative practices when students are misbehaving in the school system. The reason we need to lower the threshold is because the threshold is currently outdated. Right now, this bill would mirror IDEA when students are suspended with disabilities, and how if there's a 2-to-1 ratio, then a school system will intervene within that school. This kind of mirrors that a little bit. There was an amendment from MSDE that they would have liked to consider. Unfortunately, we got to the end of moving this bill a little later, so we didn't add that amendment. I'm okay with that amendment if they press it on the side of the street. But with that said, I've had this bill in front of you multiple times. The first time I had it in front of you, unfortunately, we had COVID and left early. The second time was last year. It made it all the way through from this committee, passed as is to the floor. I think there was a very minor amendment. Then it made it to the floor through second reader, made it on third reader, and one of our colleagues, the last day of signing, decided to special order this bill because he had questions, apparently. But with that said, I hope that this committee will do the exact same thing and move in this bill, just for the sake of transparency and trying to really understand our suspensions and data so that our researchers across the state will be able to look at these pieces of data and be able to make recommendations to the local school systems so they're able to make the necessary adjustments so that we're not sending our students out of school for frivolous suspensions. With that said, I ask for a favorable report of this bill that you moved last year that made it to third reader last year. Thank you.
Mr. Pathella, why don't you come up, speak briefly, then we'll ask questions of both of you at the same time.
Hi, good afternoon, Mr. Chair, Vice Chair, and members of the committee. My name is Frank Pathella, Senior Education Advocate with the ACLU of Maryland. We're part of the Coalition to Reform School Discipline and the Maryland Education Coalition, and we strongly support House Bill 23. Really, the data is already there. This just makes it available and accessible to the public. This committee, other legislators, advocates, State Department of Education, and local school districts have made a lot of progress on climate and suspensions, and have been laser focused on disproportionality. And this really is about keeping that work going. We have an amendment in our testimony, but that can be disregarded. It was mostly about just clarity on the data itself and how the State Department treats multiple suspensions for an individual kid. So we want to make sure that, and this probably can be worked out with MSDE, hopefully if the bill passes. But, just the data on multiple suspensions, making sure that, we can see a particular school, if it has a number of suspensions, if that, how many can be attributed to an individual child versus many children, because that has implications for how to address the issues at the school. And the last thing I want to say is that this bill works with the blueprint for Maryland's future. So all the hard work there, I think just having all the tools at our disposal to keep education moving forward in the right direction. So please, we urge a favorable report. Thank you.
Senator Riley.
Chairman. Delegate, so this is just basically a reporting bill. Was there any opposition?
I'm looking through it. I don't think so.
Unanimously out of the House?
Yes, unanimous out of the House.
Thank you, Mr. Chair.
Further questions?
I think there was a few lagging votes, Senator Rowley.
Was there any discussion in the committee as why people might be opposed to it?
The committee voted out unanimously.
But not on the floor?
Not on the floor.
Thank you, Delegate.
Delegate, on page 7, the lines 27 to 30, they talk about a risk ratio at a 2.0. Could you tell us what that's about? I'm not familiar with that.
Yeah, so thank you, Senator, for the question. What it does is that if, right now in current law, if boys are suspended at 3 times the rate as girls, a local school system will come in and, MSDE will come in and take a look at the school, reevaluate what happens and what has occurred and make adjustments within it. Right now, that's outdated, and what the commission recommended, the School to Prison Pipeline Commission recommended, is to lower that threshold so that the local school system or MSDE comes in early to detect and figure out what the issues are with suspensions. If there's black boys that are suspended at a disproportionate rate, or there's black girls or there's Asian girls disproportionately suspended at a higher rate, at 2 times the rate as their counterparts, 3 times the rate of their counterparts, someone will come in and review, analyze, and make adjustments to their work. And then what we want to do is lower that threshold to 2 so they come in sooner. Because right now, there's a lot of schools that are over-suspending racial groups at a higher rate right now than they are at their other counterparts.
Thank you, Mr. Chair. Delegate Washington, thank you for the presentation. I'm trying to better understand, looking at the purpose paragraph, and then I have a specific question. It seems to be focused on wanting to share information where there's particularly high suspending schools. And my question is, I've actually, at a local level in Wicomico County, routinely read the reports from the school resource officers. And when I read those reports, in multiple violent incidences, whether it's student on student, student on teacher, student on other school personnel, in the majority of those cases, when I'm reviewing the data, the student is not removed from the school. So, which has raised questions on the other end of how we're handling those situations. So my question to you is, do you see that all incidences would be included even if they did not result in a student being removed from the school?
Senator, this is about, this bill in particular is about disaggregating the current data that exists. So when a student is suspended, no matter if there's a in-school suspension or out-of-school suspension, that data is collected, right? And then what the school system would do is they send that information up to MSDE. MSDE compiles it and sends and puts on their website a PDF version of what they collected. And unfortunately, what they don't do is disaggregate that data at their level to make sure that we understand like how we're suspending our students statewide and what that consists of. So in your particular case, what you're talking about is in-school suspension versus out-of-school suspension. This doesn't talk about that. We just want to know the data and what the data looks like and make sure it's accurate and make sure that MSDE reflects on that data so that we're all able to really understand what the data is through suspension.
So are you saying it includes those incidences? And the concern is it's a public safety concern for the other students in the classroom or in the school. So if you have violent incidences where the student is not removed from the school, there are safety issues raised there, and we would think that we would want to track those incidences as well. So that's.
This bill doesn't change that, whether it's collected or not. This bill just says we want.
I think we don't know if that information would be collected under this bill.
If they're suspended, officially suspended, it will be collected. If they're not suspended, then they're not suspended, so that information wouldn't be collected.
So we would have information about a number of violent incidences in our schools, and we're not collecting that information.
Yeah, but this isn't about violent or nonviolent, Senator. This is about collection of data for suspensions of nonviolent offenses or violent offenses or anything else. This is about just the collection of data and disaggregating that data.
Well, this committee tends to weigh on the side of collecting more data than less, and I would think that information, particularly if it's tied to safety of students, would be valuable information.
No, absolutely. We should collect that data. We should know what that is and what that looks like, but that's not the debate here. The debate here is about collecting data and how we disaggregate that data.
I'll follow up offline to see if that information is being collected. Thank you.
Sure.
Further questions for the panelists? Seeing none, and no one signed up with opposition, although there is some written testimony in opposition. That concludes the hearing on 23. Go to Delegate Guyton, 657.
And joining you will be Cathy Carter, and then Emily Arneson and Martin Carrigan.
Thank you so much.
Welcome.
Madam Chair.
Yes, House Bill 657, Public School Standardized Behavioral Health Questionnaire for Students, Development and Implementation.
It's wonderful to be before you again. This is the last time this session, I promise, so feel free to move everything along after I'm done. I come before you today, Michelle Guyton, District 42B, to request a favorable report on House Bill 657. So it's very simple. It's designed to help provide standardized guidelines to county school boards regarding the information that's to be collected during school registration for each student each year. So currently, each one of our 24 school systems already requires a version of a questionnaire, student questionnaire, that is filled out by the parents every year. So you do, in your information, have some samples of these different questionnaires, and they range from incredibly terrific ones with lots of information, like Baltimore County and Howard County, to a few others I won't name, that only say things like, has your child been immunized and been to the doctor? So it's really, really inequitable the way that this information is being collected. And the reason that we need that information is to make sure that we can affect the allocation of resources and the services that are provided for students across the whole state, not just in those areas that are collecting more information about their students. So this bill simply puts into place an advisory group, behavioral health experts, to assist the members of the Maryland Consortium on Coordinated Community Services that was already put in place by the Blueprint for Maryland's Future, and to help develop behavioral health screenings. Now, we did in this bill go back and redefine screening as a questionnaire. So what we are talking about is a questionnaire, not an entire screening. And so there has been a little bit of confusion about that. One of the amendments to this bill actually clears that up in the actual Blueprint legislation as well. So this group will work with the consortium to make recommendations about required topics that have to be included in the school questionnaires, but the local boards still have the authority to decide how they're going to write their own questionnaires. They just have to include those specific issues. So there are a lot of different advocacy groups. I know you all hear it. We hear it on our side in Ways and Means that come to us and say, can you do a bill collecting information or asking parents about a particular issue? And what we decided to do, or what I decided to do, is to consolidate these on this advisory committee so that we don't have to do it in a piecemeal way and that everyone is efficiently working together to provide this information to the consortium. So some questions that we've had about this bill is, why are we collecting information about both health-related questions and behavioral health-related questions? And that's because health-related incidents like brain injury, like vision issues, like hearing issues, can actually mask or present as disabilities or behavioral issues. And we need to know exactly what we're dealing with when we're trying to help our kids and provide resources for them in the school system. The House actually did amend this bill to add one other piece of it, and that says that the Behavioral Health Services Coordinator will use the questionnaire to complete the coordinator's duties under this section. So the coordinator is already in place, and we're just qualifying and codifying that it is a questionnaire, and this is what that coordinator is going to use. And with the permission of parents, and that's an important part, this information can be shared with school staff such as counselors and behavioral health supporters who can actually try to connect kids with the resources that they need with parental agreement. So I asked for a favorable report on House Bill 657. We do have a favorable testimony in your packet from Kennedy Krieger, Mansef, Maryland Optometric Association, National Alliance on Mental Illness, a whole bunch of different groups. No opposition to this bill. I will say, because in case you asked this question, it was unanimous in committee. When it did get to the floor, however, it became a little more partisan. And I believe that was mostly because there was some misunderstanding about who should be on that advisory group, so I'll go ahead and address that now. There was a concern that there was not a parent on this advisory group, but this is not the place for that parent. There are other places for the parent. This is a group of experts advising on a mental, behavioral, and health questionnaire. And then another question came up about gun regulation that honestly has nothing to do with the bill at all. So because of those two questions on the House, it was split. It wasn't completely partisan, but it wasn't unanimous. So thank you.
Ms. Carter.
Hi, my name is Cathy Carter, Vision and Behavior Health Advocate. I'm asking for a favorable report for a vote for HB 657. This bill creates guidelines for the current student health questionnaires that parents answer when they register their student and allows parents to update their students' health information annually. Several districts are using these questionnaires to connect students in need to local resources, programs, and partnerships they have developed. And I asked members to review the visual comparison of the Maryland parent student health questionnaires. As you can see, these questionnaires vary greatly among the school districts, which can result in significant inequality. This bill allows parents to ask for help to support their struggling students and keep their students' health information that can impact their academics up to date. The questionnaire can support the work of each district's behavior health coordinator established by the blueprint. And it was inspired by my positive experience and collaborative work with my school district. And this bill will help find kids like my son who struggle to see clearly, get the right vision care and school accommodation. And this bill will help kids like my daughter. After struggling for a really long time to find a local health resources that were even open or accepting patients, the middle school gave me a list of local behavioral health providers, and I was able to build a comprehensive health team to support her IEP goals, and she is thriving this year. In addition, when I registered all 5 of my kids this year, I was so excited to see the behavioral health questions added to Howard County. There were questions on physical and dental eye exam, questions on mental health needs. If your child had vision problems, more specifically wore glasses, contacts, had cross eyes, like Atticus. Gaius' first grade teacher is now helping to make sure that he wears glasses because she knows he wears glasses. This questionnaire is a chance for parents to ask for help. And I ask for you to consider supporting this very important bill to help support parents who have struggling students.
Ms. Arneson, Kennedy Krieger, welcome back.
Thank you. Thank you, Madam Chairman. My name is Emily Arneson. I'm from Kennedy Krieger Institute. We are here today in support of House Bill 657. As summarized by the delegate, this legislation would create the behavioral health questionnaire, which would include a stakeholder for the traumatic brain injury or TBI field. At Kennedy Krieger, we're nationally recognized for our rehabilitation of children and adolescents with brain injury, with a strong emphasis on school reintegration and long-term follow-up. We consider it an invisible disability, and that this injury is not often shared with even the child's pediatrician, much less the school. Given that most TBI patients don't require hospitalization, these questionnaires are essential for the children to receive proper management, including behavioral health and academic supports. Due to current inadequate identification in schools, these deficits are often overlooked and are attributed to other causes, and therefore not adequately monitored and provided with behavioral health services in the context of their TBI. Enacting this legislation will help individual children and be a critical step towards systems-level research into outcomes and practices for children with TBI. And for that, we ask for a favorable report. Thank you.
Arneson, and wrapping us up, Mr. Carrigan from the Maryland Traumatic Brain Injury Advisory Board. Welcome.
Welcome. Thank you, everybody, for having me here. Appreciate distinguished members of the committee. I'm here to offer support for House Bill 657, development and implementation of a standardized behavioral health questionnaire for students. I've been a special education teacher in Maryland for 19 years. I also serve as the chairperson of the Maryland State Traumatic Brain Injury Advisory Board. I have both a master's and a postgraduate degree from George Washington University with an emphasis in acquired brain injury. I've submitted a written testimony that has all the data and statistics. I'm not going to read that. You guys have that in front of you, hopefully. The bottom line is that students with brain injury and behavioral health concerns are greatly under-recognized in Maryland schools. So I'm going to focus on trying to tell stories of two different students that I've worked with in my career and how this would have impacted them. The first student was a young man whom I first met when I was working at a residential facility for students with emotional disturbance. This young man came to the school with a lot of difficulty regulating and controlling his emotions and behavior. He had extreme difficulties controlling himself and could be best described as being all over the place. While sitting in his treatment team and reviewing his academic and medical files, I saw it documented that this young man had been riding on the back of a moped without a helmet when he fell off and hit his head. In a matter of a couple of months, the student went from attending his home school and living with his family to being one of the most restrictive placements in the state. When I brought up the possibility of a brain injury being a cause of the student's difficulties to the treatment team, it was the first mention of a student having a brain injury in his records other than a description of him falling off the back of the moped and hitting his head. The second student I'd like to tell you about is a young lady who sustained several serious concussions as a middle schooler. Even though the student was diagnosed with and treated for a concussion, her school was resistant to provide interventions and supports. Fortunately for this young lady, she had a fierce advocate in her mother, who also happened to be a social worker. Because her mother had the proof and knowledge of her daughter's brain injury, she was able to get her daughter the right interventions and support until she fully recovered. The young lady never had to leave her home school and was able to continue her education. I can tell you that young lady has since gone on to college, earned a degree, and is now a contributing member of society who's giving back. Had the first student been correctly identified and received appropriate interventions, his outcomes would have most likely been similar to the second student.
Appreciate your leadership and your testimony, and thank you for your service as a teacher. Senator Riley has a question, and I have a question. Senator Riley, why don't you kick us off?
Thank you very much. Delegate, can parents opt out of filling out this form?
Thank you, Senator. They can always opt out.
Okay, and when the information comes into the school, how is the personal information protected?
Because this is something that's going to, if the parents agree to have this shared with the school nurse and with the school social worker, then that personal information wouldn't be protected because they would actually be requesting help and they would be looking for those resources. When it goes to the coordinator, however, at the county level, then those things would be aggregated and they wouldn't be identifiable. But it would indicate how many resources needed to go to that school or that area.
So the form comes in, at what point and how does the parent say, do not share this information with personnel?
Sure. So that's written into the bill here, so that would be up to the schools to actually add that. But if you look at the examples that we give you, and now I can't find them. Had them out before. The parent can put as much or as little information as they want. So if they do not want to opt in or have the information shared, they wouldn't put that information down. So if you take a look at this, you'll see where the parents can add different information about their kids. I don't know if it would be an issue, honestly. I think they just wouldn't share the information. There's no reason to do so in that case. Right.
Question, Delegate Guyton, I have two questions for you. One is, there are a whole lot of favorable with amendments. Can you talk about which organizations you've been able to accommodate with the third reader version?
Sure, and I apologize. A lot of the favorable with amendments were a misunderstanding about whether we were talking about a screening or an actual questionnaire. Most of those and most of the opposition really were wiped away with that change in the bill. I don't know if there was anything else specific that wasn't included, and I apologize for not being better prepared for that question.
Okay, maybe you can circle back.
Yeah,
when you get a
most of
chance.
it really, though, was a misunderstanding about what that meant, what that terminology was referring to. So we did clear that up.
Thank you, Delegate Guyton. My other question was related to the effective date, which is July 1st of this year. Is it your intent that parents would complete the questionnaire and have it accessible to school personnel for for next school year?
For next school year, yes. And I think that the idea behind that is they are already doing this. So really what they just need is sort of this is a very short group. We're trying to pull them together very quickly to make some recommendations, and this isn't something that is a huge overhaul of what's already happening. So the idea is that it should be a very simple thing to do in a quick period of time. But, if this committee chooses to make a change on that effective date, then certainly we'd be willing to do that.
Okay, so this pulls together a group who has to draft a questionnaire, and you indicated in your testimony that there's some counties that do a great job and others not so great. So by July 1st, they would have to be congregating, start working on the process, then distribute it to 24 jurisdictions that would then distribute it to the schools, and all before school starts 6, 7, 8 weeks later.
I think that was the idea. Again, if
Okay.
you don't feel that that's a realistic timeline, I'm certainly willing to be
Right.
flexible with that.
Okay, I think there are people who know that
Sure.
stuff better than I do, but thank you, Delegate. Senator Simoner?
Thank you, Delegate. And I appreciate your comments, that it was very important that the parents give permission and so forth. But when I look at the page 3, lines 15 and 16, it says, "The questionnaire with the permission of the student or the student's parent shall be shared." So it doesn't, the way I read it, it doesn't say the parent has to give permission, the student could. Is that your intention, or, I mean, it seems a little in conflict with what you just said earlier.
Well, I think that the way that the parent opts out is by not doing not filling out the questionnaire. If you don't want your students' information to be shared with the school, then most parents would opt out of the questionnaire entirely. I honestly have not had this question before, so I might have to have someone who knows more about the law to say what exactly that would mean. I personally would err on the side of yes, if a student feels like they are having significant problems and they want to go to a school nurse or a school social worker about the information that's there, that is how I would write the bill, but I had not looked at that particular provision that way.
Okay, so just be clear, when it comes to the questionnaire, the parents involved, but if they want to share that information with the list that you have here in the bill, the parents don't have to give permission, and that's your intention in the bill, the way it was drafted?
I feel, I'm going to have to refer this to your committee to figure that out, because this is
Okay.
not something that was an issue at all on the House side.
That's fine.
It would be my intention, yes, that if a student wanted to share information with the school, that they could do so safely. That would be my intention. But
Okay.
that particular sentence is not something that I've looked at carefully. So I apologize again for not anticipating that.
No, and actually, I agreed with you earlier, because you said it was very important that the parent gives the permission, but, okay, does this go, what grade levels is this questionnaire for? Is it for K through 12, or is it high school?
It is currently, preschool through 12. And again, I want to go back and say, this isn't a new questionnaire. This is
Right.
something that's already happening. So schools already have policies in place for how to deal with those sorts of questions. I'm just not sure what they all are among the 24 counties.
Okay.
That is information we could try to get together. It would
No,
probably
I-
take longer than we have in this session.
Yeah, that was just a simple question for my knowledge.
Sure.
And then the last question I have, what type of questions and the scope falls under behavioral health services?
Sure. So currently, you can look, I would refer you to Howard County in your example. Do you have them in front of you by any chance?
Have the what in front of me?
Here, I'll take it. Thank you. Way too young, way too small for me to read, so I'll just do it off the top of my head. Some of the, particularly Baltimore City, Baltimore County, Howard County, actually have very good questionnaires, and they could ask everything from, has your child experienced early childhood trauma? Is there an incarcerated parent? Is there a parent who has, have they experienced abuse? I mean, these are the things, we are not saying in this bill what those questions have to be. What we're doing is putting it to a group of experts to decide what those questions have to be. But those are probably some of the more controversial that you might be thinking of that could possibly be included if this group decides that they want to make that recommendation. And again, they're only making that recommendation to the consortium. They're not actually telling the school systems they have to include them.
There you go. Senator Carosa.
Thank you, Madam Vice Chair. Thank you for the bill presentation, Delegate. I want to make sure I understand the process before I ask my questions, so they make sense. I'm looking on page 3 and line 3 and 4, that we're developing and implementing a standardized questionnaire to identify students with behavioral health services needs. So we have the purpose of the questionnaire. Then the questionnaire then, as developed, would be then given to the parents or guardians. Is that correct?
Correct, that's what happens now.
And is that offered to all parents and guardians? So then it's a matter of that parent or guardian has to do a deliberate opt-out at this point?
That already occurs, yes.
So every parent or guardian of every student in the school is given the opportunity to do the questionnaire. The questionnaire, if the parents, it's a deliberate action the parent takes or guardian to opt out. Okay.
Certainly.
Okay, the questionnaire itself is developed with no parental involvement?
So each county will develop their own questionnaire. That's what they do now. So we are not developing one single questionnaire here. What we're doing is adding an advisory group listed in this bill to work with the consortium to recommend questions and topics that should be covered in those questionnaires. So each county will put those together, word the questions the way they want to word them. We're not writing a very
So
specific.
you have a state commission of experts that
Sure.
comes up with the questions, but even with that commission, you did not see the value of having a parent on that commission?
Well, the consortium's already in place. It's already in place in the blueprint. All this is adding is a small advisory group of medical and mental health experts to that.
Okay.
Right, and of course, they could and probably are parents.
Is this questionnaire available to the public?
All of the questionnaires currently are available to the public, yes.
So a parent or a guardian has a questionnaire. They can opt in or out of doing the questionnaire. And there seems to be then a little uncertainty of whether the information from the questionnaire can be shared with other school personnel, whether that's at the student's request or the parent's request. And there's ambiguity on whether the information can be shared without the parent's knowledge.
Thank you, Senator. And again, I think this goes back to the question that we were discussing a moment ago. Again, my preference would be that certainly a student who was having issues or had an issue with, it could be something like asthma, it could be something like vision issues, or perhaps they just found out that they had hearing issues, that they could share those things if they wanted to do so.
I understand that voluntarily, but this
Sure.
is information that a parent or guardian is filling out that information.
And-
So that would be, it seems to me, information that a parent or guardian fills out, that parent or guardian should have the right on whether that information should be released to anybody.
I understand what you're suggesting, Senator, and I think it's a really reasonable question. I guess my question to you would be, why, as a parent, would you write, my child has had problems with this, that, or the other on a questionnaire if you did not want the school to know that and to be shared with someone who might be able to help them? I mean, I think that's where the opt-out comes in, right? If you don't want them to know.
Well, I think you're giving one choice, and I think I'm looking for a
Yeah.
little bit more options for the parents. If it's a comprehensive questionnaire that the parent opts to fill out, or the guardian, there could be information in there that I believe that it would be up to the parent on whether that is shared, because it sounds like this questionnaire covers quite a cross-section of information. So I think the questions you're hearing raised are, how could we increase parental involvement in this process? So that since the parents and guardians are the ones that are filling this out, and if this information is going to be used, obviously, to help the child, it just seems that it's the parents or guardian that's filling out the information, that they would have, the option to whether that information is shared and all, across the breadth of that questionnaire. So that's
Sure.
why these questions are being raised, because it's a
Sure.
little unclear in the proposed language now.
Sure. No, I actually understand that completely, and if, I'm not sure how to satisfy your question there, to be honest. I'm not sure how to satisfy it and still.
And we'll talk about it in
Sure, yeah,
committee,
yeah.
but.
We
Please
have-
do.
we
Please do,
have
because
a-
I still think there's value to bringing this committee, this group together to help form the questions. As far as how it's dealt with after that point, that might be something the committee could discuss, or.
I'm going to clarify a question that Senator Carosa asked,
Thank
and then the
you.
chair has a question. Senator Carosa, you asked whether the questionnaire would be public, and I just want to make sure, is it the incomplete questionnaire, the blank template, or is it the completed with all of my kids' personal, private?
Oh, no, yes. If that was a misunderstanding, I'm sorry. This is all health
template.
information, and behavioral health information is
The
protected.
template.
Is
Right.
protected.
So it's the,
Right.
what the blank
Right.
questionnaire will look like is public?
Yes,
Okay, I
yes,
think
thank
that
you for
wasn't
clarifying.
completely clear. Mr.
Right.
Chairman?
Yeah, thank you, Madam Vice Chair. Delegate, in terms of the charge on page 3 to develop and implement a standardized questionnaire screening to identify students with behavioral health services, then I look at the makeup of this group, optometric, brain injury, audiology, nurse. It seems to be tilted toward physical health and not mental health. And behavior is behavior. And
certainly.
While it might be generic, I think a large part of that is mental health. But the makeup of the people who are going to be citing the questionnaire seem to be with a bent towards physical health. And I'm trying to understand how that plays out. And I understand, and we've had bills about having more extensive vision screening. Ms. Carter's been an advocate of that. And a number of greater screenings, which we know take time and money as well. And we'd like to do a lot more of this on lots of physical and mental health. But I just see a little bit at odds here in terms of the charge and then the makeup of the panel.
Yeah, thank you very much for giving me the opportunity to clear that up. I've been a little bit thrown by some of the questions I didn't expect, but that one I can actually answer, so thank you. This is an advisory group basically to cover some of these areas that might mask mental or behavioral health issues, to have it included. But the consortium itself that we all put in place in the blueprint already has the experts on it that you were looking for, I believe. So, we did not feel the need to add school psychologists or psychiatrists and those types of people to this small advisory group, because they're already included in the larger group they're advising. We're just adding the very specific ones that were not having a voice that we thought could be helpful.
So implicitly, you believe the consortium is light on physical health experts?
Yes.
Okay, I just want to get to
Yes.
that. Okay, thank you.
Thank you for helping me.
See no other question. That completes the hearing on this bill. Thank you so much. And back to the chair.
Okay.
Thank you so much.
Thank you. Delegate Riley, 752, School Psychologist Recruitment Program. And if Sam Ritz and Scott Tiffin want to join the good delegate at the table, that would be great. And Delegate Henson, if you're here, you're next in line. Please, welcome.
Okay, thank you. Good afternoon, Chair Pinsky, Vice Chair Kagan, and members of the committee. For the record, I am Delegate Teresa Riley from District 35B, here to introduce HB 752, School Psychologist Recruitment Program. School psychologists partner with families, teachers, school administrators, and other professionals to create a safe, healthy, and supportive learning environment that strengthen the connections between the home, the school, and the community. They are a much-needed resource within our K-12 school system. This bill was one of the suggestions from our recommended local school superintendents in a required report that was passed, HB 844 in 2019. Then and currently, Maryland has a shortage in qualified school psychologists to work in our public schools. HB 752 establishes a school psychologist recruitment program within MSDE for the purpose of recruiting, supporting, and reimbursement opportunities for professional conferences. It will also encourage people to enter the profession, become certified school psychologists, and remain in the profession so that over time, the recommended ratio of student to school psychologists will be achieved. Currently, the rate is supposed to be 500 to 700 students per school psychologist. In Maryland, that report that we did in 2019 shows that we're about 1,200 to 1 school psychologist, plus they roam to different locations. So the program will provide support for school psychologists from groups that are historically unrepresented among professional personnel in the state. Maryland cannot afford to wait any longer to give our students the support and the resources our school psychologists provide. This is a crisis in students' behavioral and mental health issues. Teen suicide numbers in Maryland are out of control. Unfortunately, due to the additional stresses of the last 2 years, we have seen a drastic and unfortunately tragic increase in these issues. We must act now to ensure that these numbers go down. We owe this to our students and their families in our state. If you notice, the fiscal note on the bill is fairly low for what I believe this bill will accomplish. It did pass the Ways and Means Committee unanimously, and on the floor, 130 to 1. You also have in your packet some letters of support from the superintendent from Cecil County, superintendent from Harford County, and I ask for a favorable report and be happy to answer any questions that you may have.
Thank you. Sam Ritz or Scott Tiffin, whatever order you choose.
Thank you, Mr. Chair and members of the committee. My name is Scott Tiffin. I'm here on behalf of the Maryland School Psychology Association as well as the National Association of Social Workers. We just wanted to highlight a couple of things about the bill. You know, we definitely appreciate the efforts, any efforts to increase behavioral health, the number of behavioral health providers we have in our schools. But, you know, as Delegate Riley said, we are truly at crisis levels for both our school psychologists and our social workers. And, you know, although this might be a good step forward for some folks, we definitely need a much greater investment across the board on all of our school behavioral health providers if we're ever going to get even close to the nationally recommended ratios, which were also recommended in the blueprint reports as ratios that all our schools should have in order to achieve the goals of the blueprint. The other day when I was talking to the school social workers and the school psychologists, I mentioned the national ratios and the blueprint ratios, and I was actually laughed at because they were said, you know, we're so far below that, like if we could even fill the vacancies we currently have, we would be happy. We're not even dreaming about ratio yet. And so just want to highlight that the only way we're ever going to get there is significant increased investment in our school psychologists. Thank you. I'm happy to answer any questions.
Hello, thank you, Mr. Chair, members of the committee. My name is Sam Ritz, and I am a certified school psychologist in the Anne Arundel County School System. I'm also an active member of the Maryland School Psychologists Association. School psychologists are uniquely qualified educational and mental health professionals who support students in their ability to learn by applying expertise in education, learning, mental health, and behavior. While I support the effort to recruit school psychologists, I would recommend amendments to this bill. I feel that the main need is the broader investment of school psychologists and school mental health. I'd like to spend my time today focusing on the importance of addressing school psychology shortages in a more practical manner. To maintain national certification, school psychologists are already required to complete 75 hours of continuing education every 3 years as defined by the National Association of School Psychologists. To recruit school psychologists, we need to focus on more accessible training programs, funding student education, and paying equitable salaries given the level of education required to hold the job. Maryland and the nation at large face a shortage of school psychologists. Currently, I serve one elementary and one middle school totaling 1,500 students. The recommended ratio is currently one school psychologist for every 500 students. My typical day consists of attending a team or faculty meeting, completing a cognitive and other assessments, attending 2 or more hour-long meetings on students with educational programs, IEPs, counseling 3 to 4 or more students with specific social, emotional, and behavioral goals, and responding to emails, sending out rating scales, completing progress monitoring, and managing other paperwork, or simply engaging in consultation with staff. My psychological reports, ranging in length between 6 to 22 pages, are written from home. My counseling caseload is totaling near 30 students, and I have completed about 40 reports this school year thus far. There's nowhere near enough time in the day to do this job as is, and I am unwilling to compromise the integrity of my work. I'm exhausted, I'm burnt out. I recently asked my supervisor if my middle school, currently a 3-day-a-week assignment, could transition to a full week next school year. Her response was that it would depend on positions granted and, of course, people to fill those positions. Thank you again for allowing me to testify, and I ask for your consideration of amendments to this bill.
Questions to this panel? Senator Carosa.
Mr. Chair, I'll be brief. And our school psychologist, your name, ma'am?
Sam Ritz.
Thank you. My nephew is a school psychologist in Maryland as well. You may know him, Jake Wooten. The reason I'm bringing it up, when you were going over and talking about all those reports that are required, how much then is that taking away, how much time do you actually have time to spend with the students and either school personnel or parents?
So I would say that the breakdown of my day is 1/3 with students and 1/3 with staff and parents and 1/3 writing reports. But the reality is that I spend most of my time with students who, whether it's their mandated counseling hours or in crisis, or with teachers and staff supporting students, and then taking the paperwork home with me.
So you are spending the time with the students, but then everything gets backed up then?
Yes.
Okay, I understand. Thank you.
Delegate, let me ask you a question. If we pass this bill, why wouldn't we assume the PPWs, who are also understaffed and have caseloads, and social workers who are in a similar situation, and school counselors who are in a similar situation, and for that matter, we have a significant shortage of special education teachers. I'm trying to understand how we place this with a lot of shortages.
Right.
And some of the solutions, like paying for conferences. I'm trying to understand how this fits into the big picture. You know, during the 3-year conversation about the Kerwin Commission and Blueprint, many groups came in, and we tried to limit the charge to
Right.
teaching force writ large.
Correct.
And a lot of groups shared their proposed ratios from the national level,
Right.
which in most cases are far from being adopted. But again,
Well,
I give you a list of 5 or 8 groups
Correct.
that were in that category.
Correct,
And
Chair
so
Pinsky,
I'm
yeah.
just trying to understand, while we want to have more support, particularly for mental health issues and counseling, that's offered by many of these people, PPW, social workers, counselors, school psychologists. What do we as a committee and as a
Well-
legislature do? Because it also costs money.
True. So that's why, as you talked about, the blueprint, we went through many years of discussing that and going through it. The focus was more on the teachers opposed to these other categories that you just mentioned. So we thought that it was time, for us to start working on this group of people, the people like the counselor, and, I would have loved to put the counselors, the school psychologists, and all of them in this. And just after, some discussion with several people, and then also with the Ways and Means Committee, we can't keep putting it off and start nowhere. So this is a small start to try to get maybe those counselors to go, for more education to become a school psychologist. It's a certification. So again, I'm with you, and with the amendments, I would love to put the amendments on there. But again, you're saying, the cost would be would be extremely high. So, but if we can start somewhere and start with maybe our counselors and, and our, our school psychologists to push us towards, because the ratio is extremely low. And I know we have workforce issues all over, not just in the school system, but also, in the community and, restaurants everywhere. But we haven't addressed this very well, I don't think, in the blueprint, and I think we need to start doing something now. And if we don't do something now, if you can add something to it, thank you very much. But I do feel that we can't keep putting it off and pushing it down year after year. We need to do something because it's showing after the pandemic. I mean, I'm an HGO now, and to see the stats on our teen suicide, and it has increased, and, and I said out of control, it's actually appalling what is going on right now with our youth. And they need resources, they need help, and I think, when they're in the school system, these folks see them on a daily basis, and teachers aren't trained to be school psychologists or counselors, and it's the school psychologists that I believe need to be in the school full-time to actually evaluate these kids and hopefully be able to help them going forward. So that's...
And it's been suggested by myself and many others that jurisdictions be allowed to use their SRO money for social workers to be proactive rather than reactive. So, Senator Hester.
Thank you, I'm tired. Thank you, Mr. Chair. Delegate, I admire your passion for this. I just wanted to circle back to one thing. I mean, I think that there are elements of the blueprint, especially in the amendment that creates the community supports partnership, that addresses this fundamental issue. And one of the questions that they'll be looking at is how the school systems can work with outside providers and leverage Medicaid, funding. And so this isn't necessarily a comment on this particular bill, but I felt like I had to correct the record that we are doing something. It's coming, and we just added 2 more staff to that consortium to get them up and running more quickly this year.
Good. I just remember over the couple years we had some really nice amendments to add school psychologists, and then somehow that got
I know, I wanted to do that too.
Stripped away, but
this
anyway.
This will leverage federal funding for Medicaid to up those numbers. Thank you.
Thank you, and I'm just going to ask a brief question for a brief answer, but I wanted to get your input on it. I've had a couple kids myself. They're a little older now, so I haven't been in the schools as much as when they were younger. But with social media and all that's going on and pressures, I guess the question is, Sam, I think what you said, you're in elementary and middle school, and I want a very brief answer, and you can follow up with me later, but what are you seeing as the biggest mental health challenges of these kids coming to you now?
I would say there's a lot of anxiety following COVID, and there's definitely, I would say, that social media, TikTok in particular, is causing a lot of problems for us.
Okay. And I'd love to hear some more of that. If you can contact me afterwards, I'd like to follow up on that. So thank you.
You can reach him on TikTok. Okay, thank you all for your testimony and your patience. Thank you very much. That concludes the hearing. HB 872, Delegate Henson, I believe, is next. She'll be joined by Gay Green Carden, Cameron Carden, and Susan Rich. Student withdrawal policy, reimbursement of tuition and fees.
Good afternoon, Mr. Chair, members of the Environment, Education, and Health Committee. Thank you very much. I believe I got that out of order, but mostly right. For the record, I am Delegate Shanika Henson, here to present this, what I believe is a very important House bill for your consideration, HB 872. This bill passed the House unanimously and the Appropriations Committee unanimously. It does not have any opposition today. It does present with a testimony favorable with amendment. Those amendments were adopted on the House side, and they are incorporated into the bill that is before you for consideration. What the bill does is it creates the opportunity for students who have to withdraw from our university systems due to mental health treatment to allow them to seek tuition reimbursement. So we're talking about families and students who have paid their tuition and for unforeseen circumstances have to withdraw early from college because of mental health concerns. This issue came to me by way of a constituent and the namesake of this bill, whom you will hear from today. But I believe that the broader impact we can have here is to support all students who find themselves similarly situated. So what the bill would do is, based on the time in which they withdraw from school, they would get the opportunity to be recredited for that tuition that was paid, because we know the tuition is most often paid upfront and in advance. I ask for your favorable report on this very important bill, and I would reserve any balance of time that I may have for any questions from the committee. Thank you very much.
Great. Let's go to Cameron Carden first. Mr. Carden?
Good afternoon. I'm Cameron Carden, and thank you for the opportunity to appear for you today. I applied to Salisbury University on the recommendation of my football coach at Western New England University. He said it would do me good to return to my home state of Maryland, and he specifically praised the academic culture at Salisbury. And he was right. As I made clear during the appeals process, I enjoyed being at Salisbury University. The professors were engaging and attentive to student needs, and the campus felt like a safe, supportive place to learn, until, of course, it suddenly ceased to. When racist graffiti appeared in the liberal arts building, the first thing that entered my head was not who could have done this, as you might expect. As a young black man, I am no stranger to confronting racist comments and threats, even in our schools. In the weeks leading up to the graffiti, groups of students would yell out the N-word in common areas, something I've grown accustomed to ignoring. So when the graffiti escalated to the point of threatening another Sandy Hook massacre, I and any black student reading that graffiti knew the answer to who could have done this. And it's terrifying. Anybody could have done it, including the people with whom they take classes and share a living space. The next question a person asks himself in that position is this just an idle threat, or could they actually act on it? And unfortunately, we all know the answer. They absolutely can. As someone who remembers Virginia Tech knows all too well, so you have someone who is targeting black people and promising the very real possibility of a massacre, where you attend school and you're somehow supposed to focus on your studies? To be clear, I tried to focus on my studies. I tried to reach out and seek help, but my concerns over my own safety were all encompassing and made it impossible to function. This was no different than if I had suffered a debilitating physical injury. With every fiber in my being, I wanted to continue my education, but it was simply impossible to accomplish. Thank you.
If you have a little bit more, you can continue, sir.
Okay. When my story made the news, the main focus was on how unresponsive the university administration was at first. For my purposes, the faculty who I spoke to about my situation were compassionate and, to the best of their ability, helpful. However, they knew that their hands were tied by regulations that refused to give mental anguish its place alongside physical injury, which affected the tone with which they approached my case. Rather than doing everything in their power to help me restore mental balance, they ultimately worsened matters by emphasizing that my situation was about to cost my family thousands of dollars. Absolutely the last thing you want to hear in the middle of a crisis. House Bill 872, if passed, means that should a similarly racially charged incident surface, students will not have the added burden of considering lost money while also fearing for their health and safety. This is an immensely important piece of legislation, and I thank you all for considering it.
Thank you, and for sharing your experience. Ms. Carden, I guess, can be next, and then Ms. Rich.
Thank you very much. My name is Mrs. Gay Green Carden. I am the mother of Cameron Carden, and I would like to thank you for taking the time to hear my testimony. When I testified before the Appropriations Committee, I did so as an advocate for those suffering from mental trauma and anguish, and as a person financing the students' higher education. Today, though, I come before you in the most important role, and that is as a parent. As a parent, nothing is more important than your child's health and well-being, both physical and mental. Even in the throes of adolescence, when your child is at least communicative, you develop a sixth sense for when something is out of order. Within seconds of asking your child how they're doing, you know if they're being burdened by something, even if they don't openly acknowledge it. That's what happened the weekend of October 11th, 2019, when I visited my son's school at Salisbury University. It was Parents' Weekend. Even though he assured me that nothing was wrong with him, it was clear to me as his mother that he was out of sorts. Sure enough, by the following Monday, he was texting me saying that he feared for his safety and needed to leave campus. That's when it emerged that Cameron was experiencing all kinds of racial animus at Salisbury, from having the N-word shouted at him in common areas to the appearance of sexually and racially charged graffiti. In my professional life, I interact routinely with mental health practitioners and patients, and I see firsthand how our society ignores, disregards, or outright dismisses their struggles simply because they lack the visibility of a wheelchair, a crutch, or a cast. Many suffer in silence for years out of belief that you can just will away debilitating symptoms of anxiety, depression, or other conditions such as bipolar disorder, obsessive compulsive disorder, and schizophrenia. So today, I just would like to share with you that as a parent, we realize that Cameron has struggled, but we're fighting for the future students. So I hope that you adhere and favorable remarks for the HB 872.
I'm actually Dr. Susan Rich, and many of you may remember meeting me in 2016 when Senator Brian Feldman presented me on the Senate floor as Potomac Citizen of the Year. I'm a private practice psychiatrist and a member of the American Medical Association, American Psychiatric Association, where I'm a distinguished fellow. And I was formerly Child and Adolescent Psychiatry Society of Greater Washington president. But I speak not on behalf of any of those organizations. I've neither been paid to speak today or am speaking in the case of any one psychiatrist. Like the Lorax who speaks for the trees, I'm a staunch advocate for young people with mental health issues that are prevalent, underreported, and underacknowledged at Maryland's technical schools, community colleges, college, and university campuses. If a traumatic life circumstance happens to a college student after the deadline for reimbursement has passed, the burden is on the already challenged student and his, her, or their family to prove the issue led to their withdrawal and would be qualified to apply for after the deadline. Cameron Carden's case exemplifies such a circumstance. A series of traumatic experiences related to racist graffiti early in his first semester at Salisbury led to him leaving school. He was denied tuition reimbursement due to the arbitrary deadline passing, as well as having to prove that the events led to his post-traumatic stress disorder. While Cameron has moved on with his life and education here in Maryland, he and his parents are having to bear the burden of owing Salisbury University the tuition for his first semester there. He is also living with a condition, PTSD, that has taken away his love of and an aspiring career in football. His day-to-day life in his current work in public health and learning environment has been affected. The academics are triggering his feelings of distress and kindling his fears ignited during the episode at Salisbury University. He often has difficulty sleeping and frequently wakes up in the middle of the night having trouble getting back to sleep. All of these symptoms, in my opinion, have been affected by the horrific racist graffiti that spawned PTSD. Cameron's mental health functioning was impacted by the catastrophic and extraordinary circumstance that should have been considered when Cameron requested his tuition reimbursement. There are many other students like Cameron who I have seen in my home office practice since 2006 here in Maryland who have decided to leave or needed to leave shortly after the relatively arbitrary reimbursement deadline has passed. For example, COVID-related mental health issues. If universities and colleges have skin in the game, they will be more likely to ensure that students are supported through these traumas and the stressors leading to mental health problems. Such supports would enable them to thrive academically and socially and not have to leave their stepping stone to the American dream.
Dr. Rich, you have to complete your testimony.
If they are getting the tuition regardless of the outcome, they have no impetus to support students in these processes. I feel very strongly as a child adolescent psychiatrist that the Cameron Carden Act is an example of what we can do in our state to help support families who are already putting so much into their children's education. Thank you for having me.
Okay, questions for any of the witnesses? Senator Riley, followed by Senator Ellis.
Thank you very much. Mr. Carden, we're very, very distressed to hear of your issues on that campus. We have a high opinion of them, but Obviously, this is a very personal issue, and we feel some of your pain. I can't, again, understand all of it. Delegate, I do have a question for you. So we have 4 items identified. My concern is that each public university will develop different policies, creating inequities from one campus to another. Was there any discussion in your committee of putting in very specific guidelines to move this issue forward?
Thank you for the question, Senator. That discussion happened more so out of committee and with the university system directly. What the university asked for was a broad framework to work from, understanding that each campus may have different challenges, different resources, and different needs there. So what we created was really a floor and not the ceiling on that. So it would give the universities the opportunity to build on it. Right now, the challenge that you identified of lack of consistency is a concern, and so we're hoping that with this minimum framework in place, it would at least provide some regularity and some launching point for the policy.
Okay, and the second part of it is the timeline. I presume the universities are going to be interested in phasing the return of tuition over a period of time. If it's the last week of the semester, their advocacy won't be to give the full tuition back. Again, did you have any discussion in the committee about assisting this discussion with more specific guidelines?
We did, Senator. The amendments that were adopted in the House allow the universities to have a prorated basis. So the challenge was that, and I think Dr. Rich identified that in her testimony, when you are beyond that drop add period where you can withdraw without penalty, then students weren't able to withdraw except for extenuating circumstances. So what the bill does is adds mental health to those extenuating circumstances as well. Right now, the policy says for illness or injury. And what was happening is the interpretation of that illness or injury status wasn't including mental health. So with the extenuating circumstance, you could apply for a withdrawal after that drop add period, and then you could seek reimbursement of your tuition prorated to the time that you will miss from campus.
Okay, thank you. Delegate, a suggestion for next year. Let's do a study and see how well they did.
I would welcome it. Thank you, Senator.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman, and Delegate Henson, thank you for this bill. It takes great listening skills and tenacity to hear a problem and to craft a legislation to hopefully address that problem. So my hat's off to you. And I just, Mr. Carter, I'm really sorry for the issues you've experienced, and Mom, trying to get an education. Unfortunately, we have to deal with those issues. So someone, I forgot who said that if the university have some financial interests where they would lose, then they would more than likely pay attention to these issues and address them. I don't know who said that, but could you, why do you have such an analysis of it? I mean, have you seen anywhere else where this maybe is addressed from a financial perspective as far as giving monies back, and so the schools say, hey, let's take these issues seriously?
Well, I'm just going to sort of compare it to 2 of the other universities in the state of Maryland where I visited with my own daughter, which I know other people have been self-disclosing. We don't do that often as psychiatrists, but I just attended Accepted Students Weekend 2 different days this past weekend. And because of these issues, which I was just informed about a week ago, I specifically asked people these questions. It turns out at McDaniel College, they are so invested in every student being successful that they go on and really nurture those students, and they support them. And I have no idea right now what their tuition reimbursement is, but I can see the difference between that school, and again, I've been in school for 28 years, and I know something about, getting support or not, right? At St. Mary's, they were willing to acknowledge that their campus was built on the ancestral lands of the Piscataway Nation, and that it was partly slavery that built it. And this is a difference in how they are unraveling this whole systemic racism issue and addressing it. So I had the opportunity on both of those campuses this past weekend to ask students, is there any racial, slurs? Are there, graffiti being sprayed anywhere? How do you feel? Do you feel welcomed? So I was thinking, shouldn't we do a strategic plan, me being in public health, I believe in that. Shouldn't we do a strategic plan for systemic racism at some of these universities? And what do universities have, what impetus do they have to fix these things?
Okay, thank you for that. So my question was, are there any other schools or states have policies like this in place that we're trying to implement for this issue? And so.
I don't know about the issue of specifically having their own policies in place to prevent and to support mental health. But since the Virginia Tech, many colleges have been focused on mental health. I have successfully gotten students, for mental health reasons, all of their tuition back in other states, in South Carolina, in Virginia.
That's the answer I was looking for.
Yeah.
Yeah.
So by
The
me.
bill's about tuition reimbursement is what the bill's about.
Yes,
Okay.
and I just wanted to make sure that she made that connection when these schools realize they will lose tuition, they will pay attention to these things on campus. I'm kind of sad to hear it was that, how should I say, petty on the part of our school, especially in Salisbury, to say that they're not losing any money, so we don't care. And that's very troubling to me, and that's how I interpreted what the other side. And so that's why I asked that question. It's very important, and to really see exactly how we could, support this bill and move forward.
Yeah, this is Senator. Look, I don't know if Salisbury is here. I don't know if they were callous to a student, a racist student who wrote stuff up. And if they have a tuition policy, I'm not sure we should put Salisbury under the bus for being callous and accommodating racism. I don't know. I'm not judging. But I think, unfortunately, we've seen it too many places around the state and around the country, racist behavior, whether it's graffiti or whatever. Sometimes we can blame the institution. Sometimes you have an errant student who is just beyond dog whistle, unfortunately, which has been growing. So
Yeah, could I just say, I understand, and you're so true, and I'm just responding to the testimony and the
Agreed.
school they named.
Yeah.
If it was anonymous, I wouldn't address it.
Agreed.
And so I'm just really wondering, but this bill goes beyond racial issues, right? Any mental health issues that a student is going through, for whatever the cause.
or
So-
illness.
Or mental.
Or any, it says, the language says illness generally.
Okay.
So it basically will require them to change their tuition reimbursement when you withdraw across the state.
Right, okay, great. Thank you, Mr. Chairman.
Senator Washington, followed by Senator Carosa.
Thank you, Delegate, for bringing this bill, and then also for your family to use your case to try to make things better for others. Thank you for your courage also very much. Thank you. I want to better understand, because there isn't a Senate cross file, so I just need some understanding questions. Under current practice, for illness and injury and hospitalization, is there a tuition reimbursement?
That's correct, Senator. There's a
Okay.
tuition reimbursement. That illness or injury or hospitalization is the definition used for extenuating circumstances.
Circumstances.
So there's a period where you can withdraw for any reason or no reason at all, and then a period after which the withdrawal can only be for a certain designation, and one of those is extenuating circumstances.
So I guess I'm wondering, maybe committee counsel could tell me what, it looks like it's, as drafted, it looks like it's creating a new section of the code rather than amending an existing code. So could you, all right, yeah.
All right, yes.
And I also think in terms of the way we think of things, it's easier to amend something that exists than to create something new, which looks like what it's doing. So do you know anything? Because it looks like it was written to 12-124, and then it was, I guess it was amended in committee. in appropriations.
That's correct, Senator.
I just
Yeah,
need to
no, but Delegate, I think her the senator's question is, right now, there's no definition of extenuating circumstance, so it's not amending or changing any existing, it's all new language. So in other words, it's unclear by this bill if there's extenuating circumstance language that includes illness and injury, but not mental health, because all this language is new.
Thank you for the opportunity to clarify. It's been left to the universities to draft their own policies and to interpret their own policies. So we haven't had, prior to the bill, a state mandate that would require them to incorporate mental health or any sort of standard for what constitutes an illness, injury, or extenuating circumstance. Because it's been left silent in the state code, what we're seeking to do with the bill is to put in a floor, a minimum set of standards for the schools to define extenuating circumstance, and engrafted in that minimum set of standards is mental health, mental wellness as well.
I guess I'm trying to understand, do we currently have in code extenuating, okay, it sounds like we need to figure that out.
I'd be happy
because-
to.
Yeah, because the way you're presenting it is that this is already done for extenuating circumstances, and then you're trying to add mental health to it. So if you could find where in code and we could look at where that is, it seems like there's that. Because why I raise it is that the letter of opposition from the system mentions that the bill does not clearly define what conditions would meet the criteria of extenuating circumstances, and nor does it establish a timetable when the reimbursement would be realistic. So is it your
Senator-
testimony that the universities are doing this in certain situations, but they're not doing it in mental health?
I'd like to parse that out.
Yes,
I want to
great.
start, if I may, with the letter from the universities.
Yes.
Are you reading the most current version of the letter? The amendments that were adopted in the House version
Okay,
resulted in the universities supporting the bill. The way that they drafted and submitted their letter to the committee today is favorable with amendments, and then in the
Okay,
body
did
of the
not.
letter, it references those amendments as those that were adopted by the House.
That's great. Okay.
I would be happy to follow up and make sure that a copy of the most recent version is made available to the committee if you don't have access to that.
Yeah, I don't see that.
The second, in looking at the existing code
Oh, there it
versus
is.
the policy as it exists, the policy is a university policy. So the code is silent about what that policy should entail, about who's able to seek relief under that policy. We've simply left that to our universities, and each of them have different policies without any consistency, to Senator Riley's point, because we as a state haven't weighed in and said what the minimum set of standards should be. So that's what the bill seeks to do. It would be a new portion of the code, and that portion of the code would then give our universities their marching instructions on what they need to
there
do
we go.
as it relates to extenuating circumstances and withdrawals and reimbursements for this matter.
Okay, I do see that it says favorable with amendment. Do they want an additional amendment, or is this just
No,
favorable
Senator.
as amended?
That's correct. That would have been the more artful and appropriate and accurate way to word it. It is
Oh, okay.
favorable as amended.
Okay, that's helpful. And let me, what else did I want? I might come back for another question. Thank you, Mr. Chair.
Thank you, Mr. Chair. Mr. Carden, Salisbury University is in my district, and obviously what happened to you is absolutely unacceptable. And not only was the Salisbury University, but the whole community was not only heartsick, but I did want you to know, and action was taken afterwards. I know we're dealing with this bill on this issue today, but I thought it was important to let you know that the Salisbury University president did approve mental health resources and support for all students following those racial incidences. They gave students, I think, as you know, a day off just to reflect, on what happened. And they have provided additional mental health professionals and held numerous meetings. I wanted you to know it was not a one-shot deal what happened to you, that not only the Salisbury University president and his leadership team and the community has come together because it is absolutely unacceptable, and that's not what Salisbury University is known for. So I think, we're going to, obviously, we have a bill in front of us, but I thought it was very important to let you know that the additional services that have been now provided by Salisbury University, they've expanded their services to include 24/7 virtual counseling services now. So that's an update I wanted to share with you. And again, I just want to let you know, we have a bill before us, but I wanted to follow up and let you know of the action taken, not just words, but action.
Thank you.
Thank you. Just want to talk about the bill structure. The terms seem very broad. I understand the specific case, but the law's going in for every case. And so I've been through a little college myself, and I know you register, you start your classes, there's a period where you can drop out, and then usually you get less and less back, and then I guess after that point, there's the circumstances that they may let you out. That's the current situation. So if somebody after that point says, I have a mental health issue, I want to withdraw, first question is, it says in the bill that they'll adopt a policy and they will provide a reimbursement of tuition and fees for the semester. So that sounds like a full reimbursement for the semester. You said something about prorated. I don't see that in the bill. If you could just clarify that as a first question.
You are correct in are you reading lines 14 through 18 on page 2 of the bill?
That's where I am.
You are correct in that, Senator.
Okay. So let me give you another scenario since this is broad language. I'm in school. I pass the time. I'm pretty stressed. I realize I'm not doing really well. I go and say, I want to drop out of this. I have a mental health issue. So you get a full reimbursement. A lot of kids get in that situation. What is required of the student to present to the university to get that full reimbursement?
Thank you for the question. That's what the genesis of this bill. That's the very first question that we asked when we sat with council, sat with representatives from the university to get more familiar with what they're requiring to show a physical injury. Is it simply, a doctor's note? Are you signing an affidavit? What circumstances would qualify for getting the extenuating circumstances designation? And when we looked at it, it was that medical documentation and certification that the universities are looking for. But what the bill does is provides the floor. So it gives the universities the ability to be as specific as they need to comport with their own ability to review and vet the documentation, to comport with what resources are available in their area to be able to send students to perhaps be evaluated. So that's why the bill gives that minimum set of standards that requires the universities to adopt the policy, but what that particular policy looks like, the universities felt it would be over-prescriptive if we put language in the bill that had a blanket policy that said you must have, an evaluation, a doctor's note, and an x-ray, They wanted that flexibility.
Right. So it sounds like you're saying the universities would be allowed to say we need to have a doctor's note or some evaluation to get this.
That's correct.
So how did that differ from Salisbury? What did they require?
The policy that was there at Salisbury is the most common language that's used by our university, and that was that hospitalization, injury, or illness. And when it came to this particular circumstance of the injury being a mental injury, not a physical injury, he of course wasn't able to submit documentation that would show that he had a physical injury. So it was simply not elevated to the standard of being able to qualify for extenuating circumstance because the interpretation of that didn't include mental health.
Okay, that makes sense. Okay, thank you.
Okay, ladies and gentlemen, we're only halfway through our bills for the day, so let's just be conscious of that. Thank you all for testifying. Thank you for sharing with us.
Thank you.
Okay, that completes 872. Bagnall, 911. If Dan Martin, Mark Trollinger, and that's it, would like to join the delegate at the table, that'd be great. Psychologist, licensure qualifications, 911. Welcome.
Good afternoon, Mr. Chair, Madam Vice Chair, and members of the committee. For the record, I'm Delegate Heather Bagnall, District 33, Anne Arundel County, here on behalf of House Bill 911, Health Occupation Psychologist Doctoral Degree. You have my written testimony, so I'll quickly summarize. This is an important workforce development bill for the behavioral health workforce. HB 911 creates an additional avenue for postdoctoral psychologists who hold doctorates in a non-clinical psychology field to re-specialize through appropriate programs and training to enable psychologists to meet the educational requirements for licensure. This is specifically for postdoctoral psychologists who hold doctorates in a non-clinical psychology field to provide a pathway to clinical licensure without requiring the completion of a secondary doctorate. This pathway from meeting education requirements for clinical licensure for doctoral psychologists is already standard in Maryland's surrounding states, as well as within the federal government, within the VA, and the military. 40 states have open criteria allowing requirements to be met without a full respecialization. The bill before you represents hours of work and consensus with all stakeholders, including the Board of Examiners of Psychologists, who worked in good faith with our office to ensure the high standards of the profession are maintained. We have a significant deficit of licensed clinical psychologists to address our behavioral health needs statewide, and HB 911 provides an essential tool to licensure for doctors who want an opportunity to serve patients. HB 911, as amended in the House, has no opposition and passed unanimously, and for all these reasons, I would respectfully request a favorable report.
Delegate Bagnall, your lead witness is Dan Martin, Mental Health Association of Maryland. Welcome.
Good afternoon, Madam Vice Chair, members of the committee. Dan Martin with the Mental Health Association of Maryland, here in strong support of House Bill 911. I'll be really brief. Like Delegate Bagnall said, the vote was unanimous in HGO. It was unanimous in the House. All stakeholders really worked hard to come together. The Maryland Psychological Association, Board of Examiners of Psychologists, to really make sure that this thing is right and something that everyone can agree on. And basically all it is, Maryland is contending with the mental health workforce challenge that is really limiting access to care across the state. We are home to 48 designated mental health professional shortage areas, including 16 entire counties. And as demand for mental health care continues to increase, we need to ensure that our law doesn't preclude those that are qualified, willing, and able to deliver care from doing so. And so this is just a really kind of modest expansion that allows folks that already have a doctorate in psychology but that don't have, that didn't specialize in the delivery of clinical care to do that respecialization and make sure that we can expand our workforce. And so Dr. Trulinger here is really the expert on this, so I would like to kind of pass the rest of my time over to him so he can explain exactly what's going on.
The way we do it, but we're welcoming Dr. Trollinger. Thank you.
Good afternoon. Thank you, Madam Vice Chair and committee, for this time today. I just wanted to let everybody know how I kind of ended up in this situation, because I think it helps you understand. So I moved to Maryland to pursue my doctorate in psychology, which was not in clinical. However, I had a master's in clinical psychology, began work as a registered psychology associate, which I've been doing for over a decade now in Maryland. And after completing my doctorate degree, there are abilities to respecialize that are available in other states, and like was mentioned, the VA system, military, federal government accepts those standards. But in Maryland, that wasn't allowed as a route to licensure. But just to let you understand, what it means is that for me to meet the requirement for licensure, what I would do is apply to a program. Any one of the APA accredited programs can offer it. It's the exact same program that the clinical psychology PhD students or PsyD students would be going through. And what you do is you take all of the coursework, the clinical coursework that's required for the program, you do the practicums, and you do the internships. So with very few exceptions where you can sometimes transfer in a course if you've taken it for some reason, you take all the same coursework, and the only thing that's different is you don't have to do a second dissertation. And you do the same level of training in every other way. It saves significant time as far as completing the program. Second dissertation can sometimes add as much as 3 to 4 years to get it completed. So that's kind of the situation, and I just hope to be able to hopefully someday meet the requirements for licensure in Maryland and continue to live and work here. Thank you.
Thank you, Dr. Tollinger. I just have a question for the good delegate, which is the Board of Examiners of Psychologists appear to still be unfavorable. Is there?
You should have, and I apologize if it's not in there, the Board of Examiners of Psychologists sent a letter of support. Is that not in your packet?
You know what? It appears that there is both unfavorable and favorable. Okay, so your amendments then have addressed their concerns?
Yes. In fact, we worked hand in glove with the board to make sure that the language was crafted to everyone's satisfaction.
Perfect, good. Thank you, Delegate. I see no other questions. I think everybody used up their questions with Delegate Henson.
Thank you very much.
Thank you all for your testimony. That completes the hearing on House Bill 911, and there's kind of an irony that I'm chairing the committee on 911.
Thank you for your time.
All right, next bill. I see Delegate Rose, and you've been here for quite a while, so let's take you next. And then Delegate Shields, see if we can find yours in here. House Bill 1280, Delegate Rose, Public Schools, Mathematics Credit, College Preparatory Computer Science or Computer Programming Course. There are no witnesses. Welcome, Delegate Rose.
Thank you, Madam Chair, and good afternoon, everyone. It's my pleasure to be here this afternoon. For the record, Delegate April Rose from District 5 in Carroll County. This bill has passed before in 2020, prior to COVID. It passed unanimously on the floor, and just recently it's passed unanimously again, 132-0. This bill will enable county boards of education to allow computer science or computer programming to satisfy the graduation requirement for one of the math credits that are needed. This will allow localities to adopt the option, but it does not make the mandated change in curriculum. In my research on this issue over the years, code.org is a great resource and can provide a lot of detailed information. Currently, there are more than 600,000 open computing jobs nationwide. This is an increase of almost 300,000 positions since my testimony on this issue last year. We have heard consistently that there are between 15,000 and 20,000 open computing jobs in Maryland. These are all very high-paying jobs, well over double the average annual salary of other positions. Research has shown that women who try computer science in high school are 10 times more likely to choose this as a major. Black and Latino students are 7 times more likely. This trend continues to grow throughout the country. Last year, I testified that 40 out of 50 states allow a computer science or computer programming class to count toward a math or science graduation requirement. That number has now increased to 48 out of 50 states. It's time for Maryland to join the list. It's important to take this step because it places value on the class. What you will find is, as our kids are making decisions on what classes they are going to choose to take, the graduation requirements are obviously top on the list because they must get those done. So it is important, I think, to give this the same level of importance for our students to choose. The trends are aligning with much of what we have passed in the blueprint bill and have discussed over the years, but we cannot wait for full implementation of the blueprint. We really need to do something now while the plans are still being developed, because it would be my desire that no child would lose this important opportunity. We live in a technology-driven society, and almost every aspect of our personal and professional lives require computer skills. Exposing children to computer science and programming will provide them with options and exciting career paths that will provide them with opportunity for success. Polls show that 90% of parents would like to have this opportunity for their children. I have worked as a technical recruiter for more than 12 years. It goes without question that the hardest positions to fill are those in the computer science and computer programming arena. The average starting salary for a basic help desk technician is between $60,000 and $65,000 per year. As these careers progress, the average salaries are well over 6 figures in the defense sector, and recently, over the past few years, the salaries are trending even higher in the commercial sector. If the bill is passed, allowing local school boards to implement the classes, I believe we will expose all interested students to computer science and programming classes, and in turn, that will provide a more comprehensive education that will result in greater opportunities for our students. I thank you for your time and consideration, and I respectfully ask for a favorable report.
Senator Ellis.
Thank you, Madam Chair. Thank you for this bill, Delegate Rose. And what you said in your testimony, I have personal witness experience. My daughter took a computer science class in high school, and it was with the University of Maryland. And she went on, when she was a student there, to double major in accounting and management information systems.
Oh, wow.
And so that gave her the confidence to know that she could have done it. So personally, so thank you for that. So my question to you is, the bill calls for credit to be given in mathematics. Okay, so why not say in science or technology education? Or so why would you want the credit to go for math?
Thank you very much for that question. And I have been working on this issue since I've been in the legislature. The first go-around was to allow a computer programming class to count as a language credit, and that was not well received at the time.
Okay, yeah.
I then came back, did more research, and found that many, many states were doing science or math, so we tried the science route. And then after speaking with the school system and advocates over the years and amending this bill, we came to the conclusion, or they came to the conclusion, that they could live with it as a math credit, and that they felt that that was the best way to address
Okay, great.
the situation.
Yeah, thank you for that. So when it's the they, who's the they agree that math?
The State Board of Education, some of the other school systems, and we, after discussions, and my tenacity, they finally said, well, let's do
Yeah,
math.
math,
So I
okay.
said, okay, we'll do math.
So the school systems are in favor of this, support of this bill as far as?
I don't necessarily would say that they're in favor of it. I know they don't like to have curriculum dictated. However, I think that this issue is important enough to get these very needed classes available to our students. If you look at the fiscal note, if there is a career in technology opportunity for kids, they can use the computer programming classes or computer science. However, I don't know how every single county, but in Carroll County, we have limited space in our Career and Tech Center. We've recently expanded it somewhat, but we were routinely turning away 300 students or more per year who were not able to have that opportunity. In addition, the problem with that is sometimes there are students, every student learns in their own way. Some are really good test takers, some are very good note takers, but everybody's brain is not wired the same way. And I have found from talking to parents of children that struggle on the autism spectrum and students that were struggling with other learning issues, they felt that they were stupid, they felt that they were not able to achieve or accomplish anything. And when they found computer programming or computer science, something just clicks and it works and it makes them very successful.
Okay, so real quick, okay, well, okay,
So
well.
we still have a lot
So
of
really
bills.
quick, thank you. So you said 300 students were turned away from, from what were they turned away
Our
from?
Career and Tech Center, we have, the way we do it in Carroll County is we have one central Career and Tech Center. Students must apply for the positions. And one thing to take note of as well, there are a lot of students who do struggle, who don't even bother to apply because they know that the waiting list is so long. And usually only the students who get the highest grades, an A average or better, get in. So you've got students maybe have a B or a C that could maybe thrive with some of these programs, but they can't get in.
Yeah,
Okay,
thank you for
thank
being
you.
an adequate advocate.
Great. Thank you so much, Senator Ellis. I see no other questions. Thank you, Delegate Bagnell.
Thank you.
And just to answer, sorry, I know the difference, sorry. Delegate Rose. Senator Mabe and others, Maryland Association of Boards of Education, did submit written testimony, but no one signed up to speak publicly. So Delegate Rose, thank you very much. That completes the hearing on House Bill 1280 and passing it back to the chair.
Okay, we're going to take Delegate Lutke, followed by the Howard County Bill 865. I know one of the witnesses is on a time constraint. Delegate Lutke, this is major state contractors' donations to advocacy organizations, disclosure. Welcome, Delegate.
Thank you very much, Mr. Chairman, Madam Vice Chair, members of the committee. House Bill 1383, Major State Contractors, Donations to Advocacy Organizations, Disclosure, is intended to be an addition to Maryland's strong record of requirements around transparency in the political process. As you know, for many years, Maryland has been a national leader on what we require in terms of campaign finance disclosure, in terms of disclosures around lobbying. This adds new disclosure requirements regarding the funding of public influence campaigns by major state contractors. So the way it would work is that if a state contractor that is bidding on or has received more than $1 million in state contracts makes donations to advocacy organizations that then try to influence those state contracts, that contractor would be responsible for reporting that information. As passed out of the House, there are a number of amendments that we are going to propose in the committee that did not make it on the House version of the bill, and we've provided those to the committee. Those include the removal of penalty provisions related to the advocacy organization that is the recipient of the contribution from the contractor, because the onus is on the contractor for reporting, not the advocacy organization. The amendments would add language that trigger reporting when a contribution of $1,000 or more is made to wipe out smaller contributions that are likely not intended to influence the political process. The amendments would add a 24-month look-back period and finally change the auditing agency from the State Board of Elections to the State Ethics Commission, which, as you know, handles lobbying disclosure, so this is a better fit within the Ethics Commission. Bottom line is, the public has a right to know who's attempting to influence the political process. This would allow the public to have more information about who is attempting to influence decisions in the state of Maryland, and I'd ask the committee for a favorable report.
Questions for the delegate? Vice Chair.
Thank you, Mr. Chair. Contribution, Delegate, as we know in our own campaign committees, there's the direct money, there's the in-kind contribution. Someone may print a flyer or give us staff or something to help our campaigns. Is it your thinking that $1,000 would be cash, or are there other contributions that you would envision?
The intent here would be to capture financial contributions specifically.
Money.
Mm-hmm.
Okay, and then can you give us a scenario where this applies? I mean, I'm thinking that this is a problem that exists and you're trying to solve a problem that exists, or is this hypothetical?
Sure. No, it's not hypothetical. So it's become common practice all across the country, frankly, to engage in a process that opponents like to call astroturfing, right? Where a contractor will essentially make contributions to an advocacy organization that then makes the case, the public case, and applies political pressure for the government to make a decision that benefits the contractor that's funding the organization. And that makes it hard for the public to know who's actually trying to influence that decision-making. So, for example, just as a hypothetical, let's say there was a new rail line being proposed across the Eastern Shore, and the contractor that hoped to get a state contract to build this rail line made contributions to an advocacy organization that then advocated for construction of the rail line, right? That's a case where we would be looking for disclosure and more public transparency.
Thank you.
Real quick, we want to get through this bill into the next one before 3:45.
Yeah,
Senator.
thank you, Doug. So major contractor, is that defined in the bill?
It's defined as a contractor that receives or has bid on contracts worth at least $1 million.
Okay, great, thanks.
Mm-hmm.
Okay, that's great. Thank you. Delegate,
Thank you,
we're going to
Mr.
hear from the opponent, Mr. Bogdan. I see you in the back. Signed up unfavorable. Bill 865 next.
Thank you, Mr. Chairman, members of the committee. I'm Henry Bogdan, I'm the Policy Director at Maryland Nonprofits. We're not here to try to nitpick a bill. Over a long period of time, we've worked with the legislature. We've tried to strengthen regulations on charitable solicitations, the ethics laws. So we're not here lightly, but we do have serious concerns about what this bill includes. The sponsor said, his first scenario was for a contractor who already has a contract but is then trying to get somebody to influence. And I didn't understand that, but then when he laid out his hypothetical, the hypothetical that I'm familiar with this bill is you're setting up an organization or you're funding an organization to do a large public influence campaign to influence a political decision, which may well be legislation, probably will include legislation, that would lead to a contract that a contractor would then bid on and have an opportunity to bid on. There are a lot of steps in there. You'll find all that in the definition of covered disbursement. Problems are, because this bill is not only limited to the 501c4s that are typically used for this. Most of the people I've talked to about the bill misread it and assumed it only didn't apply to charities. The thousands of charities who contact you about bills on health care, on vaccination policy. We took positions on IT. The bill actually gets very complicated when you read it carefully. There's no relationship in the bill, required in the bill, between the donation and what the advocacy organization is going to do. It's simply implied that they're looking for the folks who are doing it for a purpose, but it's not, there's no specific requirement for that, which makes this very broad. The $1,000 floor is really insignificant. Nobody does major public influence campaigns for $1,000. But there are a lot of people who give $1,000 simply because they're members of nonprofit boards, and they may be with engineering firms, architectural firms. They can then be responsible with potential civil liability because there's a criminal penalty, and I do want to add, we've seen the 4 amendments that were referenced. They do improve the bill somewhat. They eliminate public disclosure of all these donations, which would have created serious, I think, serious legal problems for it. It also did put a cap of a floor of $1,000, but there are a lot of people just in their regular board giving, if they're members of boards, are going to do that in a 2-year period. There's a time period between when the donation might be made and when the communication may be made and when the contract will exist. The bill's definition, and I've pointed this out, to require reporting, you have to have a covered disbursement. A covered disbursement only exists when there is a contract that the bidder, if someone is a bidder on or has the contract. It's not potential or prospective. That's not the way it's worded. So when that communication is made by the charity, that contract doesn't exist yet. It may never exist if the bill doesn't pass. So, you know, there are issues here that we can't get into in 2 minutes. We are happy to try to continue to improve the bill. I can't commit because it does, our major concern is its effect, that it's going to create uncertainty for charities and their donors.
Right.
And
Okay.
that's hard for us to deal with. Thank you.
Thank you, Henry. Senator Ellis.
Yeah, thank you, Mr. Chairman. So, thank you, sir, for your testimony. I'm looking at page 3 of the bill, line 6 and 7. It specifically say 501c4, but you said it'll affect everyone. But
Yes.
what I read
That
says 501c4.
That misled a lot of people. That's why you probably haven't heard from a lot of charities, why I don't think there was much said on the House side. If you look at that language, it starts off by saying a person. And it goes on and says including. In Maryland, the code defines a person to include any organization, corporation, association, or other entity. In fact, the State Finance and Procurator article includes that definition. I've even verified with the sponsor's staff that 501c4 is essentially gratuitous. If you took it out of there, it doesn't change anything about the bill. It affects 501c3s, 501c4s, chambers of commerce, et cetera.
Okay. So your issue, if we make it plain that 501c3 is not included, you'll be okay with this?
I would still have concerns for 501c4 advocacy organizations because the rest of the bill is just very unclear what you're buying when you make a donation to them. Yeah.
Thank you for your testimony.
Thank you, Senator.
We will spend some time on this and speak with the Attorney General and get clear on implications and meaning. Thank you, Delegate, for presenting it. Let's go to Senator Cathy Carter Hester on 865, due process proceedings for children with disabilities. She will be joined at the table by Vicky Cretonio, Wayne Steedman, and Colleen Morris.
Thank you. For the record, Senator Cathy Carter Hester, Chair, Vice Chair, members of the committee. This is a local bill which proposes to shift the burden of proof for special education due process only in Howard County. It passed unanimously out of our delegation and out of the House. It's fundamentally about doing the right thing for students with special needs. When parents believe that their student's IEP is not being followed or implemented, most times this can be solved collaboratively through mediation. However, in instances where disagreement cannot be resolved in mediation, parents are at a significant disadvantage to prove their claim. Most are unable to afford experienced legal counsel, and they don't have access to the data on their child's learning. Now, school systems, on the other hand, have this data and the expertise and legal counsel needed to prove their case. While statewide efforts to shift the burden of proof in these cases have failed since 2013, I am really, really proud today to present a united front here in Howard County. We have our teachers union and our Board of Education, all in agreement that this is the right thing to do in Howard County. One point of opposition to this legislation claims that due process cases will dramatically increase. However, when this legislation was first introduced statewide in 2018, the fiscal note stated that that in states where the shift had already been made, there was no sustained surge in cases. In fact, after a small uptick during the first 2 years, cases actually fell. For these reasons, I respectfully request a favorable report on HB 865.
Thank you. Ms. Coutranillo, please.
Really like how you said my name there. I actually like it better than how it's pronounced. Good afternoon. My name is Vicky Catronio. I am the chair of the Howard County Board of Education, and I speak here this afternoon on behalf of the Board of Education. HB 865 was actually a request by the Board of Education to our delegation to file this bill on our behalf. And I want to take this moment to thank our delegation. Senator Lamb is here, Senator Hester, of course, for filing this bill, and to Delegate Ebersol for seeing it through the House. I'm not going to repeat Senator Hester. She has actually raised all of the points that I was going to make. Simply, I want to say this is the right thing to do. It's way past time to do it, and this will be a pilot. So the evidence that's been used previously in former iterations of this legislation, which, as Senator Hester said, since 2013, they worried about the increased legal costs and so forth. This pilot done in Howard County will provide the data, actual data, to help guide future decisions on legislation like it, both locally and at the state level. This has been amended to be a 3-year pilot, and we ask you for your consideration and for your favorable report for a bill that has been unanimously supported by the delegation, the Board of Education, the Education Association, and the House of Delegates. Thank you.
Thank you. And either Ms. Morris or Mr. Steedman?
Good afternoon. We believe that HB 865 will set right a process that is unfair to students receiving special education services in the Howard County Public School System. My name is Colleen Morris, and I am the president of the Howard County Education Association. At our monthly Rep Council, over 100 educators from Howard County voted to support this bill, and I would like to briefly explain why. HCPSS has the burden of proof when it comes to termination cases for employees. Why? Because they have all the information at their disposal to make a case. All this bill does is something similar. It moves the needle of burden by 1% onto the school system, a system, by the way, that is more experienced and has more access to the information needed to prove that they are providing FAPE for a child than a family who is trying to prove that the system is not. The suggestion that teacher workload will increase was discussed at our Rep Council meeting, but the overall data from both New York and New Jersey, from when they shifted the burden, does not support these claims. However, just in case, we agree that there would be a sunset clause. Our educators believe that this would be a step toward leveling the playing field, and creating a level playing field is what public education strives to accomplish. We urge you to let HCPSS serve as a pilot program for Maryland on this important legislation. Thank you.
Mr. Steedman.
Thank you, Mr. Chairman. My name is Wayne Steedman. I'm a special education attorney. I've been a special education attorney for 30 years. And I'm on the other side of the table from the Board of Education, so I applaud their support of this legislation. The IDEA, when it was passed with the idea that children with disabilities would receive a free, appropriate public education. And a duty was placed on school districts to ensure that children received that education. The way that education is delivered is through a child's IEP, or Individualized Education Program. And that IEP is developed in collaboration between the parents and the school. Usually that's a collaborative process, as Senator Hester pointed out. Typically there are no disagreements. But when there are, then right now, the way it's set up in Maryland is that parents must prove that the school system did not develop an IEP that meets their child's needs. The IEP that the law requires school system to be responsible for developing. At a hearing, the playing field is anything but level. School districts have control over the child's records, the educational records, and over 95% of the documents that are introduced into evidence in a due process hearing come from the school district. Those include the IEP, but progress reports, teacher anecdotal reports, evaluations, just about all the records, all of the documentary evidence. Witnesses, the school system has a plethora of witnesses, all of whom are then found to be experts in their respective field. Parents then must have their own experts testify, and the experts, their experts, are often restricted in terms of how much contact or interaction they can even have with the child in the school. For example, if an expert wants to observe a child in school, they have to get permission from the school. They're limited as to how much time they can observe. They're limited as to what classes they can observe, and they're not allowed to even talk to the teachers. So it's not a level playing field. See, my time is up. Thank you.
Let me ask a question or two. But first, let me also point out Ms. Morris from Howard County worked with us on the informal group to develop the virtual school legislation. Thank you, Ms. Morris, for that. Thank you. A question, Mr. Steedman. You mentioned burden of proof on developing the IEP. Isn't it also an issue of non-public placement? In other words, doesn't this also cover a situation where the school system might believe they can provide adequate resources and supports for students with disabilities in a case where the parent might want a non-public placement, which might cost hundreds of thousands of dollars? Isn't that also covered by this?
Well, the unilateral placement, which I think you might be alluding to, is excluded from this this portion of the bill. So the burden of proof, if
No,
parents...
I'm not talking about a unilateral where
Okay.
they just go ahead and put them in a non-public placement.
Right.
But if, after some period of time, the parent believes that the child's needs can be better met or they aren't being fulfilled by the local school system and appeals a decision not to put them in a non-public placement, who's got the burden of proof?
Under that circumstance, the school system would have the burden of proof.
Okay.
Because they have to, if they have the burden of proof, according to this bill, they have to prove that the IEP is appropriate. And the IEP is what determines placement.
Right, okay. And to the Board of Education, I see the 3-year sunset. And I guess my question to you and to the board, at the end of those 3 years, is the question of cost or liability an issue or not? In other words, if hypothetically it does raise the cost of the school system, are they going to say no thank you, or it's regardless of the cost that they think this is good policy? Sometimes a sunset is a political decision and a compromise. So I guess I'm trying to understand if you believe this should be the policy of the county and the state, or whether you really are concerned about potential cost of liabilities and if that's an issue or not.
This started as a 5-year sunset. It is now a 3-year sunset, and that's sort of a compromise. But in the end, it's about doing what's right for special education students. And so if we find at the end of this that it's increased legal costs, I think we need to look at the root cause of that. Is it because we are not providing the services, if we're not funding special education adequately, if we're not providing training adequately? I think that this will give us a lot of data. But as I said before, this will give us data, not conjecture and not assumptions. And I think it will be very helpful, not just for us, but for other, because I know that this type of legislation has been filed by more than just PG County, Baltimore. I know it's been filed by multiple LEAs, and also even during the hearings, mention was made, like, we want to see how this goes in Howard County, and I do think that this will be helpful. For me to presume what will happen in 3 years, I think would be a little ambitious, but in the end, it's about what's doing right by our families and by our students.
Thank you.
Thank you.
Thank you. Senator Lamb.
Just a quick question, I guess. I was looking at the testimony that's submitted. I don't see anything from MSEA, but you do have the support of HCEA, right, with the Howard County Education Association?
It says don't touch this, and I did. So it doesn't say don't touch this, but in a very nice way, and I certainly did it. Right, we have the support of HCEA. That's why this is because it's a locally filed bill.
Okay, to run this pilot then?
Yes.
Right. Okay, thank you.
Thank you. And Ms. Morris, do you want to speak to that?
Oh, I would,
Don't touch
She already testified,
yeah,
and
yeah.
she spoke for HCEA, so they're on board. Okay, thank you all for your patience and testimony.
Thank you.
Sorry to keep you waiting. We just have a lot of bills. Thank you.
Thank you.
Okay. Are you doing? Delegate from Montgomery County.
Are you doing Montgomery County's bill?
This is HB 812, Board of Education Data Desegregation Policy and Racial Disparity Comparisons.
Thank you, Chair Pinsky and Vice Chair Kagan and members of the committee. I am Delegate Lily Chi here to present HB 812 on behalf of the Montgomery County delegation. And I have to say, it's great to be back to present in person for the first time in 2 years. So HB 812 is a very simple local bill that requires the Montgomery County Board of Education to adopt a data disaggregation policy so that any student groups, racial and ethnic groups, that meet the threshold of at least 5% of the total student makeup or student enrolled in the system would be separately tracked for their academic performances. What that means is smaller minority groups such as Asian American students, which is not that small, it's actually 14% of the county's student population, and mixed race students, which are currently the fastest growing category, would also have their own separately tracked data and consistently reported and documented. This bill would apply to all of the MCPS data tracking and reporting, including its equity and racial disparity comparisons. It is supported by the entire Montgomery County delegation as well as MCPS Board of Education because it simply codifies the current practice but makes sure that it is done consistently, not occasionally, so that these groups would not be sometimes lumped together with whites and all others in data tracking. So with that, thank you very much, and I'm happy to answer any questions.
Questions for the good delegate. So, Delegate, the Board of Education is not doing this currently? They are not disaggregating?
That's a great question. They are to a point. They said they are tracking, but not consistently reporting as such. And the reason I introduced, I'm the original bill sponsor along with a couple of my colleagues, was because in our most recent briefing with the Montgomery County delegation, we realized that Asian American students, for example, were lumped together with whites and all others. And we said, why is that the case? And they said, it's because we track that, but we don't always report that, depending on how they look at disparity. So it's not consistently done as they should have already.
Asian or Asian Pacific students reach that threshold?
Yes, so if we cut it at 5%, it would include Asian Americans as well as mixed race students. And then after that, there's a huge drop to the next category.
Thank you.
Yeah.
Questions, Senator Ellis?
Chair, thank you for this bill, Delegate. So when you say data disaggregation, what does that mean?
Data disaggregation simply means to disaggregate the categories so that they will not be lumped together.
As in separate the category?
Correct.
Okay, which is different from when you collect data. Is this like you strip the identity of the people so you can study what's going on without impinging on their privacy? Is that part of this
I think
also,
that's
or
different. Yeah, I think that's different. Data disaggregation is something that many advocates have been pushing for in better understanding some smaller subcategories of communities.
So the separation is just basically groups.
Right.
Not to separate identifying information from individuals.
That's right. Correct.
Great.
Yeah.
Thank you. Thank you.
Thank you very much, and thank you for this bill. Some of the practices, this is the Census Bureau and some of the federal agencies have done this for a long, long time. So I do appreciate you doing this. So right now, does the board, when racial data is collected, do you have an option of check all that apply? Is that what they?
I believe now you can check mixed race as well.
Right,
in the
but-
past, that was not an
Right.
option. Right.
But is there so we still generally operate within we're constrained by these 5 racial categories, 6 sometimes that say the census and other entities use. So if you're wanting the disaggregation, you would need to have a check that'll apply. Unless the mixed option, is it a mix and then it goes through all the iterations, which would be a very long form. So what?
Yeah, so Senator, to answer your question, currently by law and the policy that has been developed by the Maryland State Board of Education, county school systems are already required, in order to receive federal funding, they're already required to disaggregate it to the point that our bill would require. It's just not being consistently presented. So MCPS told us they collect it as required, but they don't always report it as such. For example, when they reported to to Montgomery County delegation for our education briefing this year, we realized that they lumped some groups together. And so we raised the red flag and say, we want to know how those students are compared to these students, right? Because, for example, Asian American students, 14% is not a small rounding error.
Sure.
You know, it's a huge number.
Sure, and because of the intermarriage rates between whites and Asians, very high, that depending on the context, sometimes they're classified as white and sometimes it's as Asian. So I get the understand, what you're doing. But what, I just want to ask that, but I guess what I'm asking is, when you're collecting the data, so, again, we know race is a social construct, okay. But individuals, in order for you to get what you're wanting to get, so this is the county has to in some ways keep the current categories, but allow people to check all that apply.
Yeah.
If you just check mixed race without a mixture, any elaboration about what that is, then you're going to still have the problem that you have. So I would, again, just based on what you're trying to do, your mixed race category, or so-called mixed race category, has to have the ability of people to check the races upon which they consider themselves to be a member of.
If they are.
Do they do that, I guess?
I
that's the
believe
question.
so. They already have those categories, yeah.
Yeah, okay. All right, thank you, Mr. Chair.
Thank you.
Completes the hearing on that legislation. Delegate Boyce? Okay,
It's only 3.
perfect. Thank you. We appreciate that. Sorry about any kind of misinformation or communications about people signing up because we had limited testimony. So thank you for assisting us with that.
You're
This
quite
is
welcome.
HB 384, public and non-public schools, bronchodilator and epinephrine availability and use. I assume we have with you Alex Casper.
Yes.
Elaine Papp, and
Yep.
Sarah Christina Sadria-Melli.
Doctor, thank you so much.
Welcome, Delegate.
And good late afternoon. For the record, I am Delegate Regina T. Boyce testifying today on HB 384, public and non-public schools bronchial dilator availability and use, essentially rescue inhaler. I want to make note that this bill, this is the third year for this bill. It was 609 last year, and in 2020 it was 773. This bill passed both the Ways and Means Committee and the House unanimously. HB 384 requires public schools in the state and authorizes non-public schools to establish a policy to stock inhalers or albuterol in schools for emergency purposes, again, a rescue inhaler, requiring select school personnel to be trained to administer the inhaler in the absence of a school nurse, and removes personal liability of the nurse and personnel. According to the Asthma and Allergy Network, 7.6% of Maryland children have been diagnosed with asthma. 56% of children with asthma do not have an asthma plan on file at their school. And it is reported that 19.2% of parents with asthmatic children report that their children miss 1 to 2 days of school because of their asthma. Asthma is one of the leading causes of school absenteeism in the country alone. Add to those stats the number of individuals who haven't been diagnosed with asthma and the growing shortage of school nurses, we have a risk management dilemma. In the U.S., asthma is responsible for 10 deaths a day. Given these stats and risks, states are considering stock albuterol rescue inhalers in policy and in guidelines. Currently, 14 states, Arizona, Arkansas, Georgia, Illinois, Indiana, Kentucky, Missouri, New Hampshire, New Jersey, New Mexico, Ohio, Oklahoma, Utah, and Virginia have stock albuterol laws, and 2 states, New York and Nebraska, have stock albuterol guidelines. At the federal level, Congressman Steny Hoyer introduced and passed H.R. 2468, School-Based Allergy and Asthma Management Program Act in December of 2020. The bill amends the Public Health Service Act to increase the preference given and awarding certain allergy and asthma-related grants to states that require certain public schools to have allergy and asthma management programs. This federal act allows states to create and implement programs as needed with financial assistance. What I've learned about asthma is that you cannot diagnose it without first having an incident and/or attack. Unfortunately, for some, an asthmatic incident or attack is the first and sometimes last sign of a respiratory condition. An inhaler is an important and as life-saving as an EpiPen or naloxone. It must be available in our schools, and it must be added to as a stock item to the life-saving toolbox for our schools and our school professionals. And is with that, I thank you for your time and consideration and ask for a favorable report of HB 384.
Thank you, Delegate Boyce. Ms. Casper.
Thank you for the opportunity. Thank you for the opportunity today. I'm the Director of Advocacy for the American Lung Association, and we strongly support this bill and applaud Delegate Boyce for her commitment to this issue and keeping children safe in Maryland schools. You have my written comments, so I'll keep my comments brief. In Maryland, just over 129,000 children have asthma. Asthma attacks, as you heard, can occur at any time and often without warning. Children with asthma should always have access to their medication that quickly reverses the blockages in their lungs. This medication is called short-acting bronchodilators, or albuterol, and it is the gold standard in asthma care, as you will hear from our clinical experts. It's easy to administer, inexpensive, and safe. The medication is life-saving in the event of an asthma emergency. In many cases, unfortunately, for a variety of reasons, children don't always have their medication in schools and don't have access to a parent who isn't immediately accessible to provide it. As Delegate Boyce mentioned, for many kids, their asthma isn't diagnosed until their first attack. In many cases, the medication will be stocked by the school, will be used for children who are known asthmatics, who don't have their paperwork on file. again, for a variety of reasons. A study we shared earlier shows that 79% of cases where albuterol is administered, it was to children with a known diagnosis. As you hear from our clinicians, it's critical that the bill remain written broadly to ensure that we are helping as many Maryland children as possible and not exacerbating an equity issue. There is training available, which can be provided as free of charge to schools that would meet the training requirement outlined in the bill, that would allow members of the staff other than nurses to be able to identify asthma and administer the medication safely. This is similar to what is done for EpiPen now. It is simply just for a different medication. The Lung Association strongly believes that allowing schools to stock asthma medications will protect and save our kids, and we thank you for the opportunity to provide comments and encourage a favorable report.
Good afternoon. I'm Elaine Papp. I'm a registered nurse with a master's degree. I retired from my full-time job, and I worked part-time as a contract school nurse in Baltimore City. I'm here before you to share my story and to advocate for the passage of HB 384. In 2018, I saved a student's life, but I lost my job. It was a harrowing experience. While I was working at Vivian T. Thompson Medical Arts Academy, a student experienced a serious asthma flare. Her inhaler was locked in the gym teacher's office. I had no documentation that this student had asthma. The gym teacher was not in the building, and although 911 was called, they were very delayed in responding. While the principal and the teachers frantically tried to find the key to the gym teacher's office, the student lost consciousness and was gasping for air at a rate of 70 per minute, with a pulse of 124. I was helpless. I knew that after loss of consciousness, the student had approximately 15 minutes to live if she wasn't treated. I was watching the student die. Not knowing when the paramedics would arrive, I gave the unconscious student another student's asthma inhaler, but the same medication she was prescribed. Within a few minutes, she began breathing normally and she regained consciousness. I lost my job because I made a decision to save a life, and I made a decision to break the rules to save a life. This should not be a decision that anyone should ever have to make. The rules are never give a student another's medication, and never give a medication if you don't have on file a doctor's order for that medication. As a registered nurse, I had access to the Maryland asthma guidelines. I had EpiPen for allergic reactions, Narcan for opiate overdose, but I didn't have the emergency medication to treat the most common life-threatening illness among Maryland's children, asthma. I ask for favorable vote on this bill. Thank you.
And finally.
Hi, my name is Dr. Christy Sadromelli. I'm a pediatric pulmonologist at Johns Hopkins, and I'm one of the asthma specialists and experts in the state. I'm testifying in support of HB 384. So I agree that children with asthma need access to their emergency medication, albuterol, at all times, and many times they don't have it at school. Sometimes they forget their inhalers, especially older kids. They may be locked away, as you've heard, and sometimes it's their first asthma attack that happens at schools. They wouldn't have known to bring the medication, and very commonly the medication or the paperwork are not on file. This is really common. It affects all children in all kinds of schools, but it's really common where children are affected by barriers to healthcare and other inequities, such as rural and urban areas. Stock albuterol inhalers are a simple, pragmatic, and low-cost solution. Like EpiPens and Narcan, schools need to have albuterol on hand for emergencies. One inhaler can be given safely to multiple children with disposable one-way cardboard spacers, and one inhaler can last a school an entire school year. I'm co-author on a policy statement published by the American Thoracic Society, American Lung Association, Asthma and Allergy Network, and the National Association of School Nurses. This group of experts recommended that the legislation not be limited to children with a documented diagnosis of asthma. Though this means that occasionally someone without asthma will get albuterol, the downsides are minimal. It's one of the safest medications we give. The most common side effects are fast heart rate and jitteriness. It's the gold standard for asthma emergencies. You may hear today that EpiPens are a reasonable alternative, or that schools can't tell the difference between asthma and anaphylaxis. I'm here to tell you that that is untrue. Using EpiPen for asthma is off-label, and it's not FDA approved, and it goes against all U.S. and international asthma guidelines. School personnel can be trained, and they can also learn the difference between these two types of issues. And in fact, these two policies coexist in many states. So with that, I urge your favorable report. Thank you.
Thank you. Questions for the panel, for the sponsor and her panelists? Questions?
If I can speak really quickly.
Very briefly.
Sorry. I do want to say while it was unanimously voted out of committee and on the floor, there have been some discrepancies about, again, the doctor mentioned about on first incident, whether to use an EpiPen or whether to use an inhaler. And so you'll hear about that from the opposition. You'll also hear about there may be some opposition because there's an assumption that somehow we would have just a regular person or volunteer just administering this medicine, when in fact it is going to be the nurse and the nurse's discretion and the nurse's ability to choose someone that can be reliable to be able to administer medicine, just like you would if you would go on a field trip and somebody's got to carry the EpiPen to be reasonable. So those are the things that will come up, and I just wanted to respectfully put that out there as the opposition comes.
Thank you. Thank you all for your patience and your testimony. I will move to the opposition. And again, as I mentioned at the outset, a lot of people signed up, but we have limited testimony to 3 people. So, you know, I know there are a number of you that want to speak. People didn't have the information about this. I'm just going to see how this goes out. If I know there are a number of, who else is here who had signed up against? I know Mr. Willems was on that list. Mr. Tiffin, just put your hands up. I just want to see the lay of the land here. Mr. Tiffin, Mr. Willems, depending how this goes, we may allow you a quick 1 minute. So, Ms. Elliott, you want to start?
Yes. Good afternoon, and happy to be here on the last Tuesday of session, and tomorrow will be the last Wednesday, so that's very exciting. I'm with the Maryland Nurses Association, and we are in opposition of this bill. You also have letters of, different letters of information and opposition and concern that all echo the same theme from the Maryland Department of Health, MEMS, the Maryland Association of County Health Officers, the Teachers Association, also the Maryland Association of Justice. There's a group that we don't always see all together. And at the core, the opposition is on whether or not it is safe for non-clinicians to be able to administer bronchodilators or inhalers to students who do not have an asthma diagnosis or a prescription. We're here to say we think it's unsafe. We think a lot of the written material reflects that. The bill itself does not require that the individual administering the bronchodilator be chosen by the nurse or trained by the nurse. So this very much could be the teachers, the coaches, the bus drivers. And we're concerned, and you will hear that it is not possible for lay people, and I include myself in that, to be able to be trained enough to distinguish between asthma, respiratory distress from asthma, respiratory distress from other health issues, or respiratory distress from a food allergy, which means if a child is having a respiratory distress, does not have a diagnosis, the existing protocol is that child gets an EpiPen. And so this bill, we feel, will endanger children who have food allergies. We would ask for an unfavorable report. We do have a solution, which is to ask the Department of Health and the Maryland State Department of Education, in collaboration with MEMS and many of the people here, both opponents and proponents, to work on this and incorporate it into school health guidelines over the interim, because there are elements
Ms.
definitely.
Elliott, we
Thank you.
appreciate you offering a solution, and if we may have offline conversation to further.
Thank you.
Next, in whatever order you choose.
Well, good afternoon, Chairman Pinsky and distinguished committee members. I'm Dr. Charlotte Wood. I'm a professor of critical care nursing at Coppin State University and the immediate past president of the Maryland Nurses Association that represents over 4,000 nurses. The Maryland Nurses Association opposes House Bill 384. The bill's intent is to safeguard health of students in respiratory distress. However, the bill raises some very serious concerns. In fact, the bill is more likely to jeopardize the lives of those very children that they are trying to assist that are having respiratory distress because of anaphylactic shock rather than asthma. In an emergency, recognizing differentiating between respiratory distress caused by asthma, for which a bronchodilator would be administered, and a severe allergic reaction for which epinephrine would be administered, is not a simple task, and it should only be done by licensed clinicians and first responders. The layperson must follow the school's protocol to give epi and call 911. This young lady who is sitting behind me is a nursing student who is currently has a son who has both food allergies and asthma. Her son had an anaphylactic reaction, and because of the nurse being able to ascertain the difference between an asthma attack and anaphylactic reaction, her son is living today. Are you prepared for your son, your daughter, or your grandchild to be resuscitated because there's someone who cannot tell the difference between the two? We are asking for an unfavorable report, and we thank you for this time.
Good afternoon, Chair Pinsky and members of the committee. I'm a parent of two sons with both asthma and life-threatening anaphylactic food allergies. I am here to voice opposition to the House bill as it is written. My sons are now 29 and 24 years old. I have two major concerns about stocking bronchodilators in schools to be used for children with or without diagnosed asthma. My first concern is that diagnosing respiratory distress in a child is often not easy. One of my son's first anaphylactic reactions to peanuts began with respiratory distress. There were no hives, no swelling. If I had chosen to use a bronchodilator instead of epinephrine, the anaphylactic reaction might not have subsided so quickly. I could have used a bronchodilator and waited to see if it worked, but delaying the administration of epinephrine can have very serious, potentially fatal consequences. Because both of my sons also have asthma, there are times when a bronchodilator is necessary, and that's all they need to use, to alleviate their symptoms. However, I have always told them that in case their bronchodilator inhaler doesn't seem to alleviate their symptoms, they should not hesitate to use their epinephrine. Epinephrine will also act as a powerful bronchodilator. My second concern with stock bronchodilators is that the administration of inhaler is not always easy, especially with a child that has never used an inhaler. It is critical that the medication is inhaled deeply into the lungs. That is why for very young children or anyone who's being treated in a hospital with a bronchodilator, they use a nebulizer, where the medication is aerosolized and then breathed in through a mask covering the nose and mouth. I understand the bill calls for spacers to be used, and while they are helpful, I still feel that a child who has never used an inhaler and is possibly very stressed by their breathing difficulties might not get the full benefit of the bronchodilator. Thank you for your time. I ask for an unfavorable report as it is written.
We're going to ask these folks if there are any questions from the committee. Mr. Tiffin, Mr. Willems, I'm going to try to stick to my rule of 3 and 3. I apologize. You're around, you know how to contact people, and you've also both submitted written testimony. Questions for this panel? Vice Chair.
Thank you, Mr. Chair. quick question, and I'm going to direct them to Robin Elliott because I know that she knows this stuff, but if you want to defer, Ms. Elliott, to one of the other your colleagues. Number one, do you know whether other states have passed this? Number two,
We know that other states have passed stock bronchodilator bills, but not all the states have done what this bill does, which is allow non-clinicians to distinguish between different types of respiratory distress.
is there a state that you would point to as a role model for reasonable legislation if you have concerns with this wording, this verbiage?
We would be happy to do that. Our suggestion is to ask the two state agencies, in addition, the Maryland Department of Health, the Maryland State Department of Education, and the Maryland Institute for Emergency Medicine Management, or MEMS, to work with the stakeholders to determine what fits best for Maryland. It actually would be faster to ask them to do that as a study in the interim than to allow legislation to take effect in July or October and delay because of the way that they, the cycle by which they update school health
Right.
guidelines.
So I think if Delegate Boyce said she's been working on this for 3 years, I suspect that there's been informal work group things. But let me ask two more things. What is the worst thing that could happen if someone is giving the wrong drug and they're having a food allergy and not an asthma attack?
Death.
Death. Dying.
Dying.
Okay, that's a pretty severe problem. Okay, and then the last question for Ms. Elliott. You all were favorable with amendment in the House, and you changed your testimony to unfavorable. Was the bill modified in a way that caused you to be more concerned about this version of the bill?
Yes, so our support would have been contingent upon the amendments being adopted. And our amendments clarified that non-clinicians could not do this without sort of direct supervision of a nurse. The House did not accept those amendments, and then they further amended the bill. They actually went into the underlying EpiPen statute, and then in that statute requires that all school personnel get trained between distinguishing asthma, respiratory distress as a cause from asthma versus food allergy, and that really kind of strengthened our opposition. I also think you will see that reflected in the testimony, written
And the
testimony of
training
others.
that would be in the bill is not sufficient in your opinion?
Our opinion is that there is not a way for non-clinicians to be trained to distinguish between, for those different reasons, that it's just not possible.
Thank you.
Senator Guyton, followed by Senator Hester.
Thank you, Mr. Chairman. Listen to testimony on both sides. Seems like the biggest issue, possible food allergies, should be treated with epinephrine. There's a concern about that. So my question to whichever would like to answer, wouldn't most likely the school nurses or school personnel know ahead of time if one of their students has a food allergy, so they'd know how, they would know right off the bat, okay, we need to use epinephrine? Wouldn't that already be known about the student ahead of time?
Sir. No, sir. Food allergies are something that could happen to you and I at any moment during the course of our lives. We become sensitive to things, and over time, ingesting those things create that food allergy. So in the case of, would they know ahead of time? No, they may not. They may not. If somebody's already diagnosed, it's different. But if they're not diagnosed and they start to have sensitivity, especially as we get more mature.
So
Right.
it's kind of like a catch-22 there. You know, if you don't know ahead of time for the treatment for that, where you would need that, obviously is a problem. But if that person would need that inhaler, you don't know that until it happens either. I mean, what's the solution here? I mean, because we heard earlier testimony where the lady luckily saved a life by using that treatment. So, I mean, where's the common ground here where it's a win for the people that are getting their lives saved?
So if I can add, and then if Robin needs to add on a little bit more, I would say that what you heard about that story, she very clearly said that student was a diagnosed asthmatic. That is very different from someone who is not diagnosed. When someone is not diagnosed, asthma attack can mimic depending on the phase of the allergy and the anaphylaxis. It can mimic and look just like respiratory distress of an asthmatic. One is distinctly more different than the other. And if they don't give epi for the food allergy, you're going to have a resulting bad outcome.
Okay, thanks.
Thank you. I had both allergies and anaphylactic shock growing up, so I can relate to an EpiPen and an inhaler. And I wanted to zero in on something you said. When the vice chair asked you what the result was, you said death. And so of using an inhaler instead of an EpiPen. And my question is that because of the lack of an EpiPen, or is that because the inhaler is dangerous? Because I would counter that if a child is dying, you would want to use all the tools at your disposal. And I do not think that an inhaler is going to actually kill the person who is going through the anaphylactic shock. I mean, if it was my child and they had, I would love to have the training, and I think I could recognize it. But heaven forbid, if the kid's dying, wouldn't you want to give them both?
So the answer is the protocol that's exactly why the protocol in schools and the existing school health guidelines is that if there's respiratory distress and there is not a diagnosis of asthma, that the child should get an EpiPen. The EpiPen takes care of both the asthma and the potential anaphylactic shock, to Senator Gallian's question. And then what we really need is to make sure that we have sufficient resources to ensure that that child and to support the family in getting the follow-up care they need in order to figure out why that respiratory distress happened.
Your answer was slightly disingenuous before. Like, I hear what you're saying now.
I said it.
But the
Just to
inhaler is
correct.
not going to kill the child. It is the lack of the EpiPen, just so that we're all clear.
It's the lack of the
lack of the EpiPen and the delay of the appropriate treatment.
Senator Washington.
Thank you so much. Could you tell your background again? What's your training? You are former head of you're a nurse?
I'm a nurse.
Yes, just
I'm
say
a
this.
nurse of 40 years.
Mm-hmm, yes,
I've worked for shock trauma.
yes,
Ooh,
yes.
have I?
Just pull the microphone closer.
Oh, okay. So I've worked in a lot of different capacities.
Yes, yes.
I've worked as a first aid nurse for the Orioles.
Yes.
I've worked for the Ravens. I've worked in an ICU, and I've worked in shock trauma in the ICU and neurotrauma units.
And so just to be clear, in your experience and when I would imagine that a person in your position is not prone to hyperbole or exaggeration, that if you're expressing a specific concern over your 40 years of experience, which I would assume you've observed what is being carried here, that what you say here today is based on your science and your experience and your training. Is that correct?
Absolutely.
Okay. And so just to reinforce, so your concern is that if the medications or the procedures are implemented as under this bill, right, that it could end in serious consequences for young people.
Yes.
Specifically, it sounds like your concern has to do with people who are not trained, who don't have the medical background and the experience to doing this. And if they're doing it without anyone like that around, that increases the likelihood of a morbidity related to this. Is that what you're telling us?
You're spot on.
Okay, thank you very much. Thank you, Mr. Chair.
That completes the hearing on this legislation. Thank you all for your patience and testimony. Thank you to the proponents who stayed as well. Thank you, Delegate. Last bill of the day, Delegate Harrison. HB 1000, Maryland Earn and Learn Act of 2022. Sorry you were last, Delegate Harrison. Someone's got to be in that position. Sorry it was you today.
Well, that just means that you saved the best for last.
Absolutely.
Because
Absolutely.
I have no opposition, I have no witnesses, and this is a very simple bill.
3 bodyguards, 3 people moved
I
to the
do.
first row to join you and give you support.
In case you have one of those questions that I need to turn around for. But for the record, I'm Delegate Andrea Fletcher Harrison, representing District 24 in Prince George's County. Thank you so much for having me today. HB 1000 actually is a very simple bill, and you have my written testimony so that I won't go through that. What I will say is that we're pretty familiar with apprenticeships in the traditional sense, usually as it relates to, say, labor organizations. But there are other career paths that do still have apprenticeship opportunities, but they are not under what's typically defined as the Federal Department of Labor or even the Maryland Department of Labor apprenticeship guidelines. And these would be, for an example, like cosmetologists or barbers. They have apprenticeship opportunities, but they are not a part of under the federal guidelines for apprenticeships. So what this bill does is basically it just allows those organizations, those other careers, to meet these federal guidelines for apprenticeships. They would follow the same, whatever the requirement is in the state or the federal department for number of classroom hours, number of work hours. It's just that the individuals who are taking part in these apprenticeship opportunities don't have to pay for the schooling, just like in others. And so really that's all this bill does. It just expands apprenticeship opportunities. Individuals would still have to meet all of the state guidelines. They would have to take the state certifications. They just will be earning while they're learning. And it's just as simple as that. So with that, I would ask for a favorable report on this particular bill.
Delegate, let me ask you a question. Does this not happen now? I guess I'm trying to understand if they get to training through an apprentice program and they pass all the examination and fulfill all the other requirements for that license, won't they get licensed? I'm trying to understand what this does different from what we currently do.
So, yes, so currently, there are these apprenticeship opportunities, and they do still have to have the same licensing. They take the same tests. This, in many cases, would shorten their time. And as you know, let's just say with the electricians union, individuals who are part of that apprenticeship program, they're not actually paying to go to school. They're taking the class work usually in the evenings, but they're actually on the job working during the day. And so if you think of like cosmetologists, those individuals are going to a cosmetology school or a barber school, but then they are coming in later. They're paying to attend, and it may take them 2 years to get their apprenticeship, to get their license, where it could take 1 year here, and they're not necessarily spending as much money. They're able to enter into the workforce much faster.
But people in an apprentice, like the electrical worker, IBW, don't they have some hours in their apprentice program in their shop where they train them as well as going out on the job as a support to the journeyman or whatever it might be?
They do. But so with this, all we're asking in this particular legislation is for those, I'm going to call them non-traditional apprenticeship programs, to meet the federal and the state guidelines where they may not necessarily fulfill those. So if the federal or the state guidelines say that 144 hours of classroom time is required and 2,000 hours of work is required, those individuals with these non-traditional apprenticeship programs that could possibly come under this would meet those guidelines, just like any other one, and they will actually just be able to walk, they would actually be able to fulfill that requirement at the same time. So let's just say right now, you can study to become an electrician by going to the community college. So, but you don't have that, you're not getting that necessarily that apprenticeship opportunity right then and there. So it's the same idea. Nothing, I mean, the business, let's say the Penske School of Barbering, they could come under this, but the Kagan School of Barbering may desire to continue on in the way that they are currently doing their apprenticeship program.
And I hate to get in the weeds. Is there any kind of crosswalk so we'd see where it requires fewer hours
No.
or more either of instruction versus on the job? I just don't know what this means in the real world. I don't know if it's changing anything drastically. I obviously don't see any testimony from the boards, so they are silent. Either they don't know it's happening or whatever.
Well, the Maryland Department of Labor, they did call. I spoke with them. They didn't have a problem with it. None of the other apprenticeship programs had a problem with it. But so, no, there would not be any difference in the requirements. It's just that currently they don't necessarily fall. They're not certified. Certified is probably a better word. Certified under the Maryland Department of Labor guidelines for apprenticeship.
Yeah, thank you. Excuse me. Thank you, Mr. Chairman, and thank you, Delegate Harrison, for this bill. So I'm processing the bill and your testimony. And so you mentioned the Department of Labor. So there is a specific apprenticeship program to become, say, engineer, a licensed engineer in Maryland. There are like 3 different paths you can go under. One is, of course, the standard school, bachelor's. And you can also, the third one is work for a engineering firm, company, individual for, I think, a little bit over 10 years, take the exam, and you can become a licensed engineer. And when I read the bill, it talks about the board. So we have many boards, right? And so I'm a CPA, and before the college requirement for CPAs, it was apprenticeship. And they didn't require examination years ago. Now we have a uniform CPA exam. So does this bill open up to any profession that even medical could say, skip the educational part, school part, the bachelor's and professional, and have an apprenticeship program and then get full licensure?
Remember, they have to be certified by the Maryland Department of Labor and/or the Federal Department of Labor to meet those apprenticeship guidelines, certification guidelines. And so if the Department of Labor, whether it's the Maryland Department of Labor or the Federal Department of Labor, does not approve that particular entity, then they cannot do this.
Okay, so that scenario that I asked you about wouldn't probably happen as far as?
I can't say, I don't work there. I'm not a part of the department, and so it's difficult to say. I would say that, like insurance licensing, those types, and probably real estate, I doubt that they would fall under this. But as I said, it would be up to the Maryland Department of Labor and/or the Federal Department of Labor to accept those schools or those career opportunities.
Yeah. So in your vision, what are the principal occupations that might be affected by this opportunity?
So, as I mentioned, barber schools, the cosmetology schools, hearing aid dispensers, those are some. So in the example of a hearing aid dispenser, so the audiologist then determines that an individual needs a hearing aid. So there has to be somebody or some entity that understands how to create it and how to fit an individual for that. So that hearing aid dispenser has a certain level of schooling that they have to go through, and they will fall under that.
So with, say, barbers and cosmetologists, this bill would take out the requirement for them to go to actual school?
It doesn't take out the requirement, it allows them, it allows the Ellis School of Barbering
thank you. I was waiting
to
for that.
apply to become a certified Maryland Department of Labor apprenticeship school, where the Gallium School of Barbering, they chose not to. They don't have to, but everyone still has to follow and meet all of the guidelines that are there, that are already in place, take the test for their license, and then they can actually start working.
Okay.
This is just puts them in line with other apprenticeship programs if they so choose to.
Okay, thank you, Delegate.
Seeing no further questions, thank you, Delegate, and good to see you.
Thank
Here
you.
on the Senate side. Thank you
right.
for all her support staff, and
Glad you didn't ask me any of those questions where I would have to turn around and ask them to help me out.
well, and they would have looked behind them to ask someone else to answer the question.
All right,
Attorney,
thank you
good to
very
see you,
much.
Attorney.
Have a good one.
Okay, ladies and gentlemen, that completes the hearings, 3 hours and 20 minutes after we began. I'm sorry? Yes, there are no hearings tomorrow, but there is voting. Okay, let's take 5-minute stretch. Please do not go back to your office, but if you need a bathroom, a snack, a cold drink, and then we'll start with the cyber and the voting. No, you shouldn't leave, you just got here.